Also, I welcome speakers for today's conference, Dr. Raghavendra Rao, Director, Center Council for Research in Yoga and Naturopathy, Minister of Ayush, Government of India, and Dr. Vartika Saxena, Dean Research, AMS, Rishikesh, joined us online. I welcome all the organizing staffs of Unnati Foundation and staffs of Sri Kalavarameshwara Swami Ayurvedic Medical College and delegates who have joined us online and all the technical staffs who have made this program successful. So I welcome each and everyone to this program. ಪುಸ್ತಕಕ್ಕೆ ದಲಿತರವು ಮಸ್ತಕದಿ ತಳೆದ ಮಣಿ ಚಿತ್ರದಲ್ಲಿ ಬೆಳೆದರೆವು ತಲೆತಳೆದ ಪುಷ್ಪ ವಸ್ತು ಸಾಕ್ಷಾತ್ಕಾರವಂತಿಕ್ಷರೆಯಿಂದ ಶಾಸ್ತ್ರಧನದಿಂದ ಮಂಕುತಿಮ್ಮ. Bookish knowledge is like a shining diamond on one's lap. Knowledge that you gain from experience is like a never-ending tree. The real truth can only be known by knowing it and learning from the experience, not by the degree or by being educated. I request now Dr. S. Kumar to release the summary of this conference, and also I request Dr. Raghavendra Rao to release the conference summary virtually. I request Unnati Foundation staff to coordinate this program. I request Dr. Raghavendra Rao to release something online. Thank you all the dignitaries. Now, okay, thank you, sir. Now we'll move for the thank you all the dignitaries. Now we're moving for first speaker session by Raghavendra Rao. So let me introduce keynote addresser, Dr. Raghavendra Rao, Director, CCRYM, Ministry of Ayush, Government of India. Dr. Raghavendra Rao completed his BA career in second rank from Mangalore University by applicability of yoga and naturopathy intervention at various prestigious institutions of India. Served as a chancellor and Ocean PSDRC AAH Fellow and UCSF School of Medicine, San Francisco from 2002 to 2006. He completed into-US study on yoga, on prebiotic, yoga and HIV with USF School of Medicine, San Francisco. Chavez completed his PhD in 2007 and joined Healthcare Global Enterprises Limited, Southeast Asia largest network of ophthalmology hospitals. Sir has 89 international research publications and 1 international book charter. Sir is a member of Ayush Research Portal, Government of India. Considering contribution to the science, Sir has received several awards such as Sushil Mehta Pragati Member Prize in 2001, Manopali Rudraya Award from East Plaza for Best Thesis, ACO Conquer Cancer Foundation Merit Award in 2012 by American Society in Clinical Oncology. Now I request Sir to deliver keynote address. These are lead from research in alternative medicine. Over to you, sir.
Thank you, madam. Everyone, namaskara. So I'm happy to be a part of this initiative by Unnati Foundation and Government Ayurvedic Medical College and Kalabareshwar Ayurvedic Medical College as well. It gives me great pleasure to share with you that I was a guest faculty in your college in the year 1998-1999. I was taking up Swasthavritta, especially yoga, for the undergraduate students in your college. It is almost 2 decades before. So it is an honor to be again amongst all of you, to share my views on the need for research in alternative medicine. So that even before we go into this particular topic, we really need to understand these terminologies. What do we mean by alternative medicine? So let us go into this in little more details. So here, these are very important for us to understand when you talk about the word alternative. Alternative is that when you use treatments which are not proven, which are used in spite of the normal, conventional or mainstream therapies. These are called as alternative. So branding our system as alternative itself is a very futile exercise, because we know with all our practice, with all our experience over several thousands of years, okay, because Ayurveda, yoga, naturopathy, all these the Ayush systems are ancient traditional systems of medicine which have been there for centuries and have been found to be useful for patients. Only that which makes it alternative is the fact that we don't have much literature, especially good evidence-based research in this area. That is the reason why modern medicine chooses to brand us as alternate. But there is other definition of this as well. So when you say alternate, it means you are using unproven therapies instead of a conventional mainstream medicine. When you say complementary, it means using those therapies for which there is some amount of evidence on its efficacy or safety. When you're using it in conjunction with modern medicine, it is called complementary medicine. And the third and the last one, which is very, very important, is that if you are found evidence for these sort of therapies, good level of evidence, and then if you're using it instead of the mainstream therapies, for which you already have a definitive evidence, then we call it as integrative medicine. All these three are important jargons which we need to really understand, refine when we use these terms for dealing with these traditional systems of medicine. We no longer talk about alternate systems today. Okay, alternate was talked about 2 decades ago. We talk more on complementary, we talk more on integrative medicine. So if you look at the history of National Center for Complementary Alternative Medicine, so NCCAM is a part of the NIH, National Institute of Health in US government, was born in 1994. Okay, it was born because a very big survey, a census which was done in the 1990s, in the early 1990s, which showed that almost 40 to 60% of the patient population in US were taking recourse to some form of complementary and alternative medicine. And not all of this was out of the pocket expenses, means they were not insured, but they still chose to take these medicines because they felt these medicines gave them some amount of relief. That is when NIH took up on themselves to start National Center for Complementary and Alternative Medicine in the year 1994. And after 2 decades exactly, you can see that it has been rechristened as National Center for Complementary and Integrative Health. Okay? The very, very important step which has happened in NCCAM, because they removed this word alternative altogether, replaced alternative medicine with integrative health. Because they talk very clearly that health is like a spectrum. On one side you're healthy, on one side you're not healthy. And disease is where it comes on the not healthy part of the spectrum. So it is like a continuum basically. So they removed the word medicine and talked about integrative health. It talks about wellness concepts, talk about being well. Okay, because health is not merely an absence of disease or infirmity, but it's also a state of well-being, right? In physical, mental, social, and spiritual planes of being. That's the reason why they changed the word alternative medicine to integrative health. Now, if you look at all the CAM-based therapies, you can broadly classify them into various kinds of interventions. You have energy healing therapies, which talk about Reiki, which talk about magnetotherapy. Okay, you have the herbal therapies, so biological-based therapies. We call of the AUSS systems, Ayurveda, Unani Siddha, and homeopathy. Okay, phytotherapy, botanical therapy, okay, or nutraceutical therapy. So all these things come under the ambit of biological-based therapies. Then you have the mind-body intervention therapies. Okay? So mind-body intervention therapies are talking about yoga, meditation, tai chi, art therapy, music therapy, etc. And then you have the manipulative therapy, which talks about massage, talks about chiropractic, talks about osteopathy, and various whatnot. And you also have Chinese medicine, the Eastern therapies, which are also clubbed under biological-based therapies as well, the traditional Chinese medicine. Okay? And you also have acupuncture, which also comes under energy therapies as well. Okay? So these are some of the gamut of therapies which are interdisciplinary. They have certain philosophical contexts are very common among most of them, because they talk about holistic view of a person. They don't talk about disease as a disease in a person. They talk about the person who has the disease. So I'll come to this later on, this concept later on, as I go ahead in my slides. Second. Then what is the definitions? As I said to you, alternate is in place of a special diet or herb to treat cancer. The cancer patients usually say when they feel that there is nothing there to take care of their disease, they may say this particular diet or this particular herb may cure cancer. Don't know have evidence for that. They start taking this instead of chemotherapy or instead of surgery or radiation therapy, call it as alternate. We take it along with these treatments, we call it as complementary. For example, post-surgery discomfort, reduce nausea. Some even take recourse to aromatherapy as well. Okay, so combined mainstream therapies for CAM, which we have no evidence, is called integrative therapies. We'll come to all these examples later on now as I go ahead. So what is the prevalence of CAM? Very large number of studies are there which says that complementary and alternative medicine prevalence ranges between 7% to 98%. Okay, so systematic review of 26 surveys of 13 countries. Estimated average prevalence is around 1 in every 3% uses CAM, that is 31.4%. Okay, and in case of in Indian cancer patient, it was 56.6%, which was there in Indian cancer patients. So I'm going to give an example of oncology because that is where my forte has been, where I've done a lot of research studies in addressing these particular use of these therapies and trying to integrate these therapies into cancer care. What is a better indicator of CAM today is not just the surveys which you have done every other different places, because they differ from place to place, they differ from condition to condition. CAM prevalence for asthma, CAM prevalence for asthma is different, whereas the CAM prevalence for cancer is different, arthritis is different, heart disease is different, etc. What is very important for us to understand, look at the market size of the CAM. That is very important indicator saying that people take recourse to CAM much more than ever before. So if you see in US, $30.2 billion every year is out of pocket expenses which is spent only on cam therapies. Okay, they spend on physician visits, they spend on complementary alternative medicine practitioner visits, they spend on taking over the counter drugs, especially nutraceuticals. Okay, they take natural products, they take prescription drugs. Okay, so all these things which are there are seen in US, where you can see out of pocket expenses is around $30.2 billion. When it comes to India, if you look at the herbal market, very huge market here in India. Okay, and you can see it's growing by over almost 20%. So you have the skin care, you have hair care products, you have body care products, and you have others as well. So here you have the herbal cosmetic market is also going up. Herbal medical market is also going up very drastically and very fast-paced manner in India. So where are these alternate treatments used? Why do people take recourse to alternate treatments? This is a very, very important question, because people want succor, people want relief from particular diseases. So they go to alternate treatments or complementary alternative medicine. They believe that something is going to cure their diseases. But it is very important for us to understand that there are certain conditions which are chronic, which are there for life, and which has to be managed for life. Example, diabetes, hypertension, gastritis or dyspepsia, irritable bowel syndrome, okay, asthma. Okay. All these need to be managed for life. So you may probably get it in episodic, you may have episodic attacks of these particular diseases or these conditions. Symptoms may aggravate, symptoms may subside, patient may go for remission, so on and so forth. These are there, come and go whenever they have to come and go. Okay, it depends on the person's exposure, depends on stress, lifestyle, and various other conditions. And they're also used in conditions where there is no cure. People start using complementary alternative medicine in case of muscular dystrophy. You start using it in case of cancer. Because once everything is done in cancer, the cancer is recurred or it is already metastasized to other parts of the body, they want to take recourse to some sort of form of therapy. That is where they go in search of complementary alternative medicine. They take a CAM, especially in congenital abnormalities, especially disorders where there's no vision, loss of hearing, etc. They take in genetic diseases, just like muscular dystrophy I told you about, cancer, HIV. Okay, and many of the NCDs also patients start taking recourse to is CAM therapies, especially in case of diabetes, in case of heart disease, especially in diabetic neuropathy, metabolic syndrome, mental illness, so on and so forth. So in almost all kinds of diseases, okay, all kinds of diseases, you see some form of CAM therapies used, except in case of acute conditions where you have an emergency visit to a hospital. Except in those cases, most of the other cases, you see patients taking recourse to CAM modalities. Okay, so if you see the integrative medicine in USA, okay, these are the areas where they have been using, and there's a very nice collaborative association among all the integrative medicine centers in USA. So I'd like to tell you that all the major medical teaching hospitals and universities in USA have an integrative medicine center. MD Anderson Cancer Center, UCLA, UCSF have what is called the Osho Center for Integrative Medicine. It has been developed by NCCAM earlier. It is a chair. It has been given funding for developing the particular center in almost all the medical teaching hospitals across US. So Harvard, you can talk about Mayo Clinic, Memorial Sloan Kettering Cancer Center, Dana-Farber Cancer Center. Wherever you go, you have MDs, you have modern medicine specialists who work along with the integrative medicine practitioners to develop integrative care. I was there in a hospital called Banner Health Foundation, the largest chain of private cancer hospitals in US, and it was in Arizona and Phoenix. And there was a very good doctor called Dr. Santosh Rao, who's an Indian origin, hemato-oncologist. He was also director of the Integrative Medicine Center. He did his MD in Integrative Medicine from University of Arizona. After he did his MD hemato-oncology, and he was using it for almost all the conditions. I was saying acupuncture is giving acupuncture during chemotherapy, preventing nausea and neuropathy. He was using yoga for most of the patients. There was a patient, all the patients were undergoing a distress screening by using PHQ-9, and they had a very nice protocol. So those who have distress, they undergo psychological therapy, they undergo counseling, they undergo yoga, they undergo Tai Chi. And those who had pain, myofascial pain syndromes, were undergoing massage therapies. Okay, those who had other problems, especially who were taking chemotherapy, were undergoing acupuncture. So it was a very systematic, methodologically done kind of a center. And I was astonished to see that there were more than 200 to 300 patients visiting that center every day. get recourse to treatments. And all these centers like this in US, the top medical centers in US, have formed a collaborative called Bravewell Collaborative, and they brought in a very nice research report, and they've said that CAM interventions are useful in managing chronic pain. 70% of the CAM interventions are used for chronic pain, 59% for gastrointestinal disorders, 55% use them for depression or anxiety, 52% are used in cancer, and 22% are used in stress. Okay? And these are all the conditions in which CAM therapies are being used. And this is a very big database which they have maintained across all these therapies. And this Braver collaborative database links the electronic health records of all these institutes together, and they're able to take out this kind of data. Okay? And they also looked at how much of them have got cash and how many of them have got insurance reimbursement. And the thing is, in US, insurance reimbursement is given for acupuncture, is given for consultation for integrative medicine practitioner, is given for massage, is given for all mind-body interventions like yoga, tai chi, etc. Is given for nutrition advice, okay, nutrition as a therapy is given for all these things. But we had to go a long way to reach this particular goal because integrative medicine are not under the ambit of insurance reimbursement as far as India is concerned. These are the centers employing the following practitioners, either full or part-time. And you can see integrative medicine physicians, 96% of them are headed by a physician, modern medicine physician. They have massage therapists, they have meditation instructors, they have acupuncturists, dietitian, nutritionists, PCM practitioners, yoga instructors, psychologists, nurse practitioners, acupuncture, biofeedback practitioner, homeopathy practitioner, Ayurvedic practitioner as well, physician assistant, physical therapist, exercise physiologist, chiropractor, hypnotherapist, a naturopath. So all these are employed are being employed in most of these hospitals, and you can see the percentage of these people who have represented themselves in this thing. And for Indian systems still have to be represented more, except for yoga. Other systems are not much represented in US. Okay? So when we talk about integrative medicine, we also have to talk about levels of evidence. And this is a very, very important slide because whenever we say level 1A, 1B evidence, it talks about very high quality research, high quality evidence. It talks about a strong recommendation. So where do you get this high quality research or evidence from? This comes from multi-centric randomized controlled trials. The first word is very important, multi-centric. Multi-centric will help in removing the bias. It helps in looking at what is happening in reality across the centers, and it is more in line with the general population or general practice. And this is a very, very important evidence. Very few of few of our therapies have really reached to that particular level, except for yoga. I don't see multi-centric RCTs and giving level 1, level 1A, and level 1B evidence in case of Ayurveda, except for one or two drugs which they have used. It has been published in NEJM and other things. Okay, they use one for Pikachu. They have used it in case of Parkinson's disease, and except for that, you don't see much of these other drugs, other parts of Ayurveda coming into the limelight as far as multicentric trials are concerned. Then you have 2A, 2B, where there's weak recommendation. You have RCTs, but they're done with very low sample size, single center RCTs, and they don't the eyes most of the time when guidelines are formed. Guidelines are when guidelines are formed or when this is being discussed among the experts or peers. So we have different levels of evidence based on the quality of evidence, the robustness and rigor of the trials, and these are very, very important in research. Okay? So what when you say task force recommendations for using oncology? So I'm just trying to use cancer as one of the important things because I want to show to all of you how we can do integrative medicine in cancer. What are the areas? And when you want to start practicing integrative medicine, how do we do that? Okay, what is happening today, unfortunately, in our country is that we have Ayush going on one part of the track, and we have the modern medicine going on another track. They hardly meet or seldom meet. Okay, there is no integration happening. Either you do Ayush or you do conventional medicine. Okay, each of us don't know the science of the others, don't respect the science of the others. We end up in heated debates, and we end up at the end of it, don't come to a conclusion where we can integrate our practices together. That has been the problem in our country, and that needs to really change. And that can only change because their demand, the conventional medicinal practitioners demand we develop evidence for our therapies. So it is important that we also start publishing papers and research papers. Only when we do those kind of activities, evidence is there sufficiently for them to also engage us scientifically and work with us together so that we can develop integrated medicine protocols. So here, when you look at this particular diagram, all the studies which are done, okay, should have should confirm intervention should confirm the two important things: safety and efficacy. Okay, if it is all this B and D, we not be using. If it is not safe, don't use. If it is having no efficacy, we don't use. But if we have some amount of efficacy, we still use. We have efficacious and but safety is not so conclusive, we still use. But if it is safe and efficacious, this is a number A on the quadrant in the right upper quadrant. This is when most of these interventions are really recommended and are continued to monitor. Okay? So this is how we recommend interventions when you start using it in integrative medicine. So let us look at integrative medicine in oncology. So CAM prevalence in cancer. If we start talking about this, based on studies done and literature published in all these countries, in Canada it is 93%, in North America and US it is 90%, it is 90% in South America, especially in Brazil, Argentina, and Chile, and etc. 51.5% in UK, 31.4% in Europe, 67.5% in the Middle East, 56% in India, 64% in South Africa, 61% in Australia, and 98% in China. Why 98% in China? They have integrated traditional Chinese medicine and acupuncture along with conventional care. Any big government hospital in China has got PCM, has got acupuncture, has got Tai Chi practitioners who integrate their care or integrate their therapies along with conventional mainstream medicine. They've already been mainstreamed completely into the healthcare scenario. Okay, it's not happened in other parts of the globe. We did a study in our own hospital, CG Cancer Hospital, across 4 different institutes: Bangalore Institute of Oncology, it's in Double Road, Bangalore Institute of Oncology Specialty Center in Kanindara Rao Road, Bharat Hospital in Mysore, and HCG Cancer Center in Borivali in Mumbai. Okay, so we looked at prevalence of CAM in Indian cancer patients for taking first line of treatment or primary cancer directed treatment, we call them as. Okay. 305 patients were done, and we looked at number of cancer directed treatments these patients were receiving. We looked at number of people who took recourse to complementary alternative medicine versus no CAM. So 26% recourse to complementary alternative medicine, the one in the blue. Okay, 26% to recourse to complementary alternative medicine. These are patients who are newly diagnosed to have cancer, receiving first line of therapy. I'm not talking about people who already completed treatment, who already had recurrence, not those people. I'm talking about those with first line of therapy. And what we saw was this is a split up of all the cancers. Majority of them were breast cancer patients with solid malignancies. Okay. You had lung, head and neck, gynecological, ovarian cancers. You have stomach and colon cancers. You have bladder and renal cancers, ovarian cancers, brain cancers, and other cancers as well. Okay. And if you look at breakup of CAM use, Ayurveda was stopping here. 55.3% of them use Ayurveda, 28.2% use homeopathy, many of the 9.7% use some form of herbal supplement, which was not Ayurveda or anything else. 14.6% used yoga. Some of them use naturopathy and other things as well. So this is the breakup of CAM. And we went to find out why they wanted to use CAM. Okay. One was, the major reason was they felt that these interventions can't do any harm. They are devoid of side effects. We also know that our own medicines can have some amount of side effects if they're not used judiciously under the supervision of a doctor. Okay. The patient perception was that CAM medicines don't have side effects. They don't cause any harm. Okay, unlike modern medicines. Why? Because when you start comparing CAM with respect to chemotherapy, chemotherapy will invariably cause nausea, vomiting, invariably cause colitis. And radiation to intestines or the abdominal region will also cause colitis. Radiation to the oral mucosa will cause oral mucositis. So there is going to be a side effect associated with cancer directed treatment because of the toxicity involved with the cancer treatment itself. Then they also believe, 73% also believe CAM treatment will offer cure. So many of them went to recourse to these things saying that it will cure. Many of them started using it because they came to know from others that it helped them. So these are some of the areas by which people take recourse for CAM use in cancer. Okay. Among them, we try to find out how many of them are informed their doctor about their CAM use. Only 42% inform their doctor about their CAM use. So that I'm taking this medicine also along with chemotherapy or with surgery or radiation therapy, whatever it is. 60%, nearly 60% of them did not inform the doctor about the CAM use. Why? Also wanted to know why they did not do this. Simply said, doctor did not ask. Okay? Some of them said, forgot to tell. And some of them were confident that they have used before. 37% did not want to tell the doctor because they feared for disapproval by the doctor. 28% said, doctor does not need to know. Okay, like they felt that they are in control of their treatment and they know what they want to do for their peers or their patients, and they said doctor did not need to know. So this is a very big gap which you can see, okay, between the patient and the doctor. It's a gap which relies on trust, which relies on communication as well. This can also happen to all of you as well. You may probably advise something for the patient. The patient may not follow it. Right? So this is very, very important for us to understand this. So if you look at prevalence of CAM according to different treatment modalities, okay, psychiatric disorders, especially in case of cancer patients, suffer from psychiatric disorders, 41.7%. Fatigue, 98.3%. Fatigue is a very, very important problem and symptom in cancer patients. 98.3% of the patients take recourse to using CAM for fatigue. Okay, in 35 to 67% across various cancers and treatments. Oral mucositis, head and neck cancers, 40%. Diarrhea, especially colitis because of radiotherapy, 30%, which grade 2 and 3 cities. Chemotherapy-induced nausea vomiting is present in almost 90% of the patients. Tingling in arms and feet is present in 30% of the patients, especially due to chemotherapy because of neuropathy. And only, again, very important aspect to understand is patients are undergoing all these problems along with the cancer-related treatment. Okay, but these are not addressed for most of them. Patients have depression. Okay, fine. Try to counsel them. Try to be positive. Try to be cheerful. That's what the doctors will say. Patient has fatigue. Doctors will say, take a rest. Can I? Don't go out. Don't do the work. Stay at home. If you have pain, you require more pain. Doctors will give some more medications on that. Painkillers are given, which can cause further problems. Okay, painkillers can also cause constipation. Okay, and diarrhea and colitis is there in 30% of patients who receive radiation to the abdominal region. Nausea vomiting is a very important problem in chemotherapy. We have antiemetics to stop vomiting. By stopping vomiting, we cause nausea. Okay. This nausea can lead to malnutrition, can lead to anorexia. Okay, because you have anorexia, you have lots of appetite, loss of taste, you don't feel like eating, and you don't take food, and you have chemotherapy. The blood counts are coming down, and because of the malnutrition along with anorexia, the blood counts go down drastically. You may have to stop chemotherapy. You may have to give the patient transfusion. Okay. Tingling arms and feet, especially neuropathy, is a very long-term complication. It's therefore initially after chemotherapy it starts off. For some people it persists several years as well. It never recovers again. So this is again a bigger problem. We have nothing to do with to do for neuropathy as well, especially in allopathy. So we need to find out what are the problem areas in oncology. We'll come to that later on. So here, if we look at clinical trials, what are clinical trials have been done, especially in case of these Ayush systems of medicine in cancer. Okay, like if you look at mind-body medicine, huge number of clinical trials are there, RCTs are there. Herbal medicine, also you have Chinese medicine, significantly very high number. When you look at Ayush systems, very less. Yoga, we have only 76. That's the highest, by far the highest. You can see yoga intervention in oncology. When you see Ayurveda, Unani, Siddha, homeopathy, hardly anything. Just because in cancer hospitals, you only give cancer-directed treatment. You don't try to see the use of other treatments along with cancer. And if it is used in some of the centers like Kidwai and other things, they don't try to do research on this. Okay, they don't start publishing evidence on this. This is what is required, and that is what is lacking in our country today. Okay, this is what you can see. And if you look at all trials, if Ayurveda, for example, if you look at Med Ayurveda cancer, 2 clinical trials are there. All article types, 186 are there in cancer. Okay. Percent of clinical trial is hardly 1%. Yoga is on 31% of it is clinical trials. Okay. Unani nothing, Siddha nothing, homeopathy only about 4%. Okay, Chinese medicine 4.62%. Again, 740 clinical trials are there, but total number of publications in Chinese medicine in oncology, 15,804 are there. Okay, the percentage of the clinical trials which are important for us to understand, because that is where your decision making comes, clinical decision making comes, and that is very, very low in our Ayush systems compared to other systems in the world today. Okay? So if you look at Cochrane reviews, very, very important for us to understand. 137 Cochrane reviews are there on alternative medical systems. In Ayurveda, there's 8, Nashpati 1, Homeopathy 15, alternative therapies 3. But when you last start looking at those along with cancer, hardly anything. Okay, because we don't have research studies in this area. So traditional Chinese medicine, Eastern traditional medicine, 110 reviews are there, out of which 10 of them are in cancer. Homeopathy, there's 1 review on cancer. Okay, so this is very important, because what is this Cochrane review? Very importantly, this was formed mainly because several reviews and meta-analysis which started happening up by different groups. Some of them said this is useful, some of them said this is not useful. So they come up with one particular review called Cochrane review. It's a very standardized review, and this is taken as the benchmark for saying whether the intervention really works or not works. And if you see Cochrane reviews based on complementary medicine, sorry, the slide is getting repeated again. Okay, so if you look at this is on CAM, it's overall CAM, and if you see there Cochrane reviews, alternative medical systems, you have 137, Ayush in cancer only 1, energy therapy is 201, Ayush in cancer 0. Okay, so mind body interventions 159. Okay, so all these are different aspects of Cochrane reviews, and these are evidence based therapies. Now, coming to use of our medicines, for example, this is called as a Pacific U. All of you must have heard about it. Taxus brevifolia, it is called. It is called the Indian Pacific U, found in the Himalayas, especially in Nepal and higher reaches of Uttarakhand and etc. Okay, these are red berries, leaves, and the bark, and these are used for preparing a drug called Taxol. Okay, so this Taxol came to the market. A very interesting story of this. It's a drug called Taxol. This was founded by Bristol Myers Squibb, a French company based out of Europe, and they were the CEO of the company was going into Himalayas and visited a village where he saw women who had ovarian tumors. People were giving the decoction of this particular herb, and people were having respite, and ovarian tumors were disappearing after they took this particular decoction. This is a native folklore medicine involved in Himalayas, and when they started taking out, he took out this bark, took out the extract of this plant, and found out the chemical composition of this particular compound called Taxol. This is a very, very important second line chemotherapy drug used in breast, ovarian, and lung cancer treatment even today. Okay, so what we say here is most of our knowledge is there. We have a lot of knowledge in Ayurveda, we have a lot of knowledge in Siddha, we have a lot of knowledge in Unani. Okay, we have a lot of knowledge in yoga and naturopathy as well. But they are allowing the foreigners to take care of this one. For example, I can tell you, same with this Pacific U would have been taken up by the Ayurveda people. They also have the repository of this particular drug. You know that this drug is used for cancer. They also have text references of this particular drug in Ayurveda as well. But nobody did any sort of a clinical trial using the Ayurvedic methodology to show that this has anti-cancer properties. Okay, as the modern medicine people took it out, got this drug as a Taxol, and brought it to the market. It's a very big pioneering chemotherapy drug today. Okay? This is the story of all our ancient systems. So these are there for centuries. We have not done sufficient amount of work to translate them into level 1, level 1A, and level 1B evidence for to be used in mainstream therapies. So unless we don't do that, somebody else is going to do that. Simple thing is yoga as well. Or for example, you take what is called Buddhist meditation, okay, or mindfulness practices. So all of the yoga, whichever type of yoga you talk, different types of yoga you see today, it's the same thing. It's got the same Ashtanga yoga principles. It's got the same type of practices, but they are being capsuled in different names. For example, Vipassana meditation, which originated in India, has been propagated mostly by Buddhists initially, was taken to the West by John Kabat-Zinn. About 40 years or 30 to 40 years before, he started popularizing this as mindfulness-based stress reduction. Today, if you go and see PubMed, MBSR has got more number of publications than yoga. Okay, it's got more number of publications, more number of clinical trials compared to yoga. What is MBSR? It is a form of meditation. It is a part of yoga. Okay, West is separated yoga as, yoga is, meditation is a part of yoga, but West has separated yoga as two different ones. Physical form, which where you do the asanas, etc., is yoga, and the meditation form where you do the mindfulness practices is the meditation. Both are different jargons which have been used in yoga, and the reason for this also is because yoga went to the West through the yoga gurus. It was mainly because the yoga gurus started professing meditation practices initially. Maheshwari Yogi, okay, and he's the one who started off transcendental meditation. For the first experiments on yoga or benefits of meditation was seen in the West because of the experiments done there in the Western countries and by Wallace et al. And colleagues. And that is how they became very popular. So these are being delineated, these have been divided, and these have been capsuled for their own audience. And that is happening because we are not bringing about research the way we should be doing here in India. Okay. So what is scope of Ayush in oncology? What can be done really? So I'm just going to give a small glimpse. The same thing can be applied, the same yardstick can be applied for all uh, all other specialties as well, be cardiology or rheumatology, whatever it is. You can go to those particular regions, start working with those people, and start doing the same kind of a diagram. So there are difficult symptoms which are difficult to take care in cancer: fatigue, loss of appetite, anorexia, constipation, dry mouth, xerostomia, anemia. Okay, complications due to treatment: oral mucositis, chemotherapy-induced nausea, vomiting, low counts, neuropathy, hepatotoxicity, renal toxicity, dyspepsia. These are all the complications. Quality of life issues which are not really taken care of in the conventional mainstream medicine, where if you have a depression, you give psychiatric. You go to a psychiatrist, he gives you antidepressant, or gives you a mood elevator. If you have anxiety, they give you anxiolytics. You don't teach them how to take care of their thoughts, how to train their mind, how to adjust to the situations, how to develop acceptance of the problem. There is what is called as a Dabda effect in cancer patients. The moment they are diagnosed to have cancer, deny they have cancer, they go to another doctor, go to another lab, another test they do. They try to find out whether somebody tells them the hope that it's not cancer. Once they know it's cancer, once they accept that they have cancer, they start bargaining with doctors. And they say, can I do without chemotherapy? Can I do without radiotherapy? Can I just have only surgery? Okay. So they start bargaining. Even if that doesn't help, they get depressed and they get anxious. Anxious because after treatment, what will happen? The cancer is going to come back to me. The cancer is going to spread to other parts of the body. So all these things are some things which thought process which really happen in the patient, which require acceptance by the part of the patient, not medications. You over medicate them with all medicines and medicines and medicines, and they end up with more and more side effects and more complications, which you will not be able to manage at all. Okay. For example, painkiller medicines will cause constipation. Okay. Anything to do with constipation, laxatives, other things will cause another problem. Okay. So like this. So it keeps on building up one over the other. So this example, managing morphine-induced constipation. So what I'm talking now about is where we can integrate. So what they've done is there are studies which have been there, which have been published. And again, here very important for you to understand is we are publishing our papers only in our own journals. For example, Ayurveda you have Journal of Ayurveda Integrative Medicine, AIM, Pune. Now as well as you have the AYU is a journal from the CCRS in Delhi. So we are not trying to publish them only in our Ayurveda journals, but we're not publishing them in the mainstream journals. And that is again a very important aspect because nobody is going to take our journals seriously because it is peer reviewed by our own people, our own fraternity. So they are not going to recognize or they're not going to allow. So we should learn to start publishing in mainstream journals. So for example, this is a very good study on managing morphine-induced constipation. Herbal preparation, Visarka Snehanam was given. Okay. And once daily dose, low cost, it can be used as a prophylaxis in patients who receive morphine for managing pain. Okay. This is very useful in managing functional constipation or morphine-induced constipation as well. Okay. Then you have dry mouth or xerostomia. Rasayana avaleha can be given as well as adjuvant to radiotherapy or chemotherapy in reducing adverse effects. Here, very important aspect we should take into consideration is you can't give antioxidants during radiotherapy. Okay, because you start giving, because radiotherapy works on the principle of producing free radicals of oxygen, it can bind to the cancer cells and kill the cancer cells. Now, if you give antioxidants, okay, these antioxidants are going to quench these free radicals and reduce the efficacy of radiotherapy. So this you need to be really very, very importantly understanding that whatever preparations you are giving, see that they're not having antioxidant function, but they can have anti-inflammatory function. Okay? They can have anti-inflammatory function, but not having antioxidant function. This is very, very important. And they found the improvement in taste in this particular Valeha as well. Okay. So what are the herbs used in oral mucositis? A lot of work has been done on using uh, several things called Triphala Churna, Yashti Madhu, okay, honey, herbal mouthwash, honey, okay. So all these things have been shown to reduce severity of mucositis. Okay? Because what happens in mucositis is all of them will get mucositis. It comes usually by second week of radiotherapy. It will peak up during second and third week of radiotherapy and then slowly start dissolving. Okay, along with mucositis, you have severe infections, ulcers. You can't open your mouth. You have a locked jaw. You have a trismus. All these are some of the important aspects. You have speech problems, articulation problems, and so on and so forth. This is very, very important, which you can start taking care of in patients. Okay, so honey was being used, okay, especially in oral mucositis at grade 3 and 4. It helps in reducing symptoms and complications. Indian turmeric powder with honey again was also used. So turmeric powder, here again, tell people start using the word curcumin here. What studies have again found out is done a lot of work on curcumin. They looked at the nanoliposome form of curcumin. Today they are again coming back to the roots. They are saying forget turmeric or curcumin, start using the whole turmeric as a whole. Okay, so use turmeric with milk or with honey, and this is going to be useful in case of this. This is enough kapha B blocker. It is a potent anti-inflammatory analgesic. Okay, and this can be used in case of mucositis. So chemotherapy induced nausea, vomiting. Huge amount of trials are there using ginger, okay, using citrus fruits or lemons. Okay, so there are some of the now people have started doing the lemon drops, okay, citrus drops, which patients are asked to chew or just swallow them or just chew them around, keep it in their mouth as a lozenges till they're during the course of the chemotherapy to reduce the feelings of nausea. Okay, so a lot of these things have already come up in the practice. These are some of the things which are there used in different aspects of cancer. So these are the medicines which have been used for various other indications. Okay, and these have been published in Journal of Ayurveda Integrative Medicine. It's a review article. Okay. So very important for us to understand is to look at all the evidence-based things. And I was trying to find out what evidence is already there. So there's a combination of Ayurvedic drugs used for improving physical well-being, supportive care in cancer. This is a paper published by Varda Center, where they usually treat cancer patients along with Ayurveda and normal conventional medicine, radiation and chemotherapy as well. Ashwagandha for improvement in physical well-being and quality of life, reducing fatigue, especially in cancer patients. So all these are very important because these are coming in mainstream journals. And that is where we have to start focusing on. Okay? This is when we have been taken seriously. Now again, you can see this. This has been developed by. This is nothing but honey-based dressing. They have shown that it is very useful in case of cancer-related wounds, malignant wounds. Okay, it reduces the wound size and it improves the wound cleanliness as well. It keeps the wound clean. So this can be used. Honey-coated bandages can also be used in wound dressing in cancer patients. This is called a barrier dressing. This is a barrier dressing for colostomy wound. And you can see here, this is a Raya powder. Okay, this is from the bark, which is found very common in Western Ghats. It's called Karaya leaf or Karaya bark. And this gum or resin is taken out and powdered form is used. And this can be used as a barrier dressing to prevent infections. Okay, and this is also very useful in case of patients who have bed sores, who are terminally ill, who have pain, and who are bed sores. The application of Karaya powder can be very useful for bed sores as well. Okay, an example. This is called Circulia gum, basically found mostly in Kerala and Western Ghats in Karnataka. Okay, and these are some of the studies which are there on interventions in cancer patients in systematic review. It's published again in Journal of Ayurvedic Research in Ayurvedic Sciences. And again, this is not really a review; it's just a compendium of all the studies. Okay, review is something different. Systematic review is something different, where you do proper meta-analysis and then you try to do that. But none of these studies had meta-analysis. So should start talking about applications today. So this is very important for us to just come to yoga meditation and then go to Ayush later on. And if you see the amount of publications outside yoga, amount of publications inside yoga, okay? The outside India, the publications are quite high, okay, very high. Okay, you have the yoga as well as meditation as two different publications. So the outside India, the publications are very high. Inside India, publications are very low. Okay, it is 20% of the total PubMed. These I'm only talking about PubMed index publications, not publications in UGC related journals because they don't carry much weightage today. Okay, so in PubMed publications, if you want to see, we contribute 20% of the research publications on yoga. India contributes. Okay, US alone is about 41% of the publications on yoga. Okay, so we have the Western countries doing more research on our systems than us doing research on our systems. Okay, this is a sad state of affairs today. But when it comes to meditation, it's much lower. We contribute only 6% of the publications on meditation, as the Western contributes to 94% of the publications on meditation practices. Okay, same thing if you look at Ayush sector here, you look at Ayurvedic publications here. Okay, here also the same story goes on, same story repeats here. Okay, so you look at publications from outside India for Ayurveda is also quite high. Okay, publications within India is quite low. And most of the publications are not done by Ayurvedic doctors. These are all done by botanists and researchers. And that is again a sorry state of affairs. In Unani, the same thing goes. Same story goes for Siddha as well. Okay, same story goes for. And all these publications which are done by Western countries are all researchers in modern medicine. They are botanical researchers, molecular biology researchers. These are plant biologists who want to do research on plants. These are people who are publishing uh, very good papers in very good journals outside India, okay, and impactful journals. We are not doing those things, being in the profession. Same thing goes, the story goes on and on, be it any system of medicine, we are lacking behind in publications. So unless we publish, we start encouraging research in the educational institutions, the PG students, and the research has to be done with a lot of collaboration. Unless we start doing this, we will not be able to bring evidence level for the practice, for practicing our system as an integrative medical system along with allopathy. Okay. So professional alternative and complementary integrative medicine in PubMed, when you see, so total, you start using the word, these three keywords. So the alternative medicine is the, when you use a keyword, the number of publications you see is about 52% of these publications. 40% of these are complementary, only 8% of these are integrative medicine. So this is a very important aspect to understand that we are still known as alternative systems of medicine. And we have to work in getting this integrative medicine as a larger part of this particular pie. Okay, we are a very small part of the particular pie when integrative medicine is concerned. We are more known as alternative medicine, kept away from the mainstream medicine. And this is a very important eye opener for us. So unless we do research, we start increasing this integrative medicine scope and increasing the pie, the section of the pie which is as integrative medicine, will not be taken seriously. Okay, there's a promising evidence published in Ayush journals, literature suggests effectiveness of Ayush interventions in oncology. Okay, we need to translate this effectiveness to robust, acceptable evidence, and this can be only done by clinical trials. Okay, so today, if you see modern medicine, I'm just using the slide which I was preparing for Chairman SCG. Okay, before people were talking about evidence-based medicine. Today they talk about personalized medicine. This personalized medicine is the same concept which we all start talking about. Each person is different, so the treatment for each person is also different. Ayurveda talks about doshas. We also talk about constitution. Okay, we talk about gunas, etc. So now what modern medicine is doing is breaking down the disease down into smaller compartments. They are going to genomic level, and as and when they go to genomic level, you get more amount of heterogeneity. It's not so simple thereafter. People are now going to precision medicine, precision radiotherapy, targeted chemotherapy, are trying to target the disease as a whole. Okay, you want to avoid unnecessary treatment, improve outcomes, but again there is a pitfall for this. Okay, more and more deeper you go, more and more variability you can start getting. It's very difficult. People are now start using artificial intelligence from imaging. There's radiomics, there is genomics, there is proteomics. All the omics are being used today, and trying to develop different algorithms to take care of medicine. Okay, there is what is called as a Watson is there for diagnostics and clinical decision making in cancer. So you just have to put the details of the patient, put the diagnosis, put the histopathology type, grade, the grade, the staging, etc. All the molecular markers, blood report, etc. And it'll tell you what treatment to be given. So they are going to that kind of an extent. Okay, but still, if you see oncology today, all these things being done. Okay, in oncology, or forget other areas also. Evidence with all the evidence-based medicine and other things which we are talking about. Okay, we are coming up the same place. What is happening here? You see on the left side here down, the mortality rates from cardiovascular disease is just only increasing. Mortality rates from cancer has never come down. It is also increasing. Mortality rates from diabetes and other diseases, respiratory diseases, is also increasing. So is it for diabetes. So all the chronic diseases which we are talking about, NCDs we are talking about, mortality rates are only increasing. So what evidence-based medicine are we talking about? Okay, we negate holistic medicine. We embrace evidence-based medicine, embrace compartmentalized medicine, and from there we are going much deeper into personalized medicine. We are trying to go into precision medicine. What we are not understanding here is we need to see the body as a whole. More deeper and deeper you go, more diverse and more heterogeneous things become, more complex it becomes. So it's better to address the person as a whole rather than compartmentalizing each of these complex systems. Okay, that is what needs to be done today. Okay, so this is a very famous note. So it was a note from the Latin archives. It says you have fever. Initially, in the earlier times, whenever you had fever, with the root concoction, then they should say the root isn't effective. Visit the Bagan. Person who does spells. The spell doesn't work. Take the potion. Potion is toxic. Take the pill. Now we came to the pills cause side effects. Take the root. It's like we are going back to the roots again. Okay, so it is history repeating itself. So it is here where we have to really get carefully, develop the evidence for our systems of medicine so that we are taken seriously. We move from the imbroglio of alternative system of medicine to integrative medicine. This is an era of integrative medicine, not alternative medicine. This is where we need to transform, we need to transition. And this can be only done through good collaboration, good effort, and good amount of research studies between various institutions, various individuals, and organizations. And we in the department at the Ministry of Ayush, at CCR1, Central Council for Yoga Research, we have started mind-body interventions through yoga in all the Institute of Medical Sciences. Okay, AIMS Rishikesh, Dr. Vartika is there today to start to deliver a talk on this. We have started work on AIMS Raipur, starting in AIMS Bhubaneswar, AIMS Jodhpur, AIMS Jajjar, okay, and PGI Chandigarh, and so on. End of next year, probably we'll have all the AIMS. We'll have branches in all the AIMS and doing a lot of research with the modern medicine practitioners to integrate yoga into conventional care. The same way, what we are also trying to do is also encourage their people to also do small studies like MD and DMD students to also do small studies using yoga interventions so that the respect for our interventions will start developing the evidence by developing evidence in a joint fashion. So this is very, very important, and the same thing should happen with other Ayush systems as well. So we have a Ayush center in almost all the AIMS now. A lot of research is not going on. So it is it's just like a lip service is being provided. And unless we make it very serious effort to research in all Ayush systems, so this integration will not happen. I hope this really happens and takes off. And with this, I would like to end my talk. Thank you so much for a patient hearing. I'll be happy to take any questions if there is time.
I thank Dr. Ravindra Rao for his keynote address on the topic, the need of research for alternative medicine. Science system of students. So with this, I will express once again thanks to the Ravindra sir. Due to busy schedule, next speaker, Dr. Indra Suraj, staff cardiologist and cardiac electrophysiologist is not joining us now. Recorded lecture of sir will be made available in Unnati website. You can go through by tomorrow. So it's my pleasure to introduce Dr. Vartika Saxena, Dean Research Professor, Head of the Department of Community and Family Medicine, Head of the Department of Ayush in Rishikesh, Advisor for Telemedicine Committee in Rishikesh. Madam has over 24 years of wide-ranging professional experience in the field of public health, especially MCH, nutrition, and NCDs. Madam has worked with various national and international agencies for improving health status of out-of-reach underprivileged communities. She has a member of National Task Force for Adolescent Health Program, Iron Pulse Initiatives. She has conducted various statewide field trials on vitamin A folic acid fluorosis. Madam has added about 40 extramural and intramural projects funded by various agencies like WHO and UNICEF. Madam has credit of over 75 research publication and book chapters. I request to speak on the topic achieving synergy between modern medicine and Ayush. Over to you, ma'am.
Thank you so much for an elaborate introduction. Are you able to see my slides? Kindly confirm whether you are able to see my slides.
We can see.
Okay. So first of all, I would like to thank Dr. Saraswati Hegde, founder, president of Unnati, for giving me this opportunity to speak about the very important topic of achieving synergy of allopathy and Ayurveda. And I would like to really commend her for slating this kind of seminar for the students of Ayurveda and other Ayushpathies. This is a very important point, and my previous speaker, Dr. Raghavendra Rao, has already elaborated that how much this is important that we focus on generating evidences in Ayushpathy so that we can put our mark on the global map. So Dr. Raghavendra Rao has already made my task very easy to explain the subject, but keeping it very basic because now we are addressing to UG students and more interns. So I'll specifically brief them about the research terminologies which are actually needed for them to understand how we can take research at a higher level, especially in the Ayush stream. Before I go into the details of my presentation, I would like all of you just stop thinking and just focus on this aspect. Are we really interested in having a synergy between Ayurveda or allopathy, or we think that we are in a race to win? Because if we think that we are having a race to win over each other, I think we won, and we expect that being taught twice, Ayush being taught twice is ultimately going to win. If that is what we are thinking, or we have some other thought, we need to think this point seriously. We all know that during the current time, there is a passionate debate going on. Dr. Raghavendra was emphasizing, we are discussing a lot about the relevance and effectiveness of allopathy versus Ayurveda. These days, at many forums, I see that this discussion is going on, whether allopathy is better or Ayurveda is better. But we need to think both the pathies with a kind of audit exactly what is needed out of a medical system. If you talk about the principle of medicine system, basically what we want prevention of a disease, we want preservation of health, protecting person from these different diseases, prediction of future diseases, and we want to rejuvenate a person so that they can have a healthy, happy life. Whether it is a allopathy or Ayurveda, our expectation from each of them, they are the same. So are these pathies, they are able to provide prevention, preservation, protection, prediction, and rejuvenation or not? That we have to see. When we talk about the allopathy and Ayurveda, we know that one is modern system of medicine, which is much more based on the chemical based products, and other one is the Ayurveda, which we know as a herbal based traditional medicine. So whether we can use them together or individually, that depends on the situation, type of disease, and the outcome which we are expecting out of that particular context. If we talk about allopathy, there are some glaring facts. Dr. Rao has already elaborated, but again, I would like to emphasize, yes, this is not to hide that allopathy is a synthetic industrial product, and that results into chemical manipulation of system. When you ingest a pill, definitely there happens a change in your in different system of your body. There is a chemical change which happens in your body, and if that medicine is used on a long-term basis, definitely that can help you to control a particular disease, but definitely it can affect other systems of the body. Because it's not that only, suppose we take a medicine for hypertension, it's not that it is just going to control or lower your blood pressure, it is going to affect your kidneys also. So sometimes long-term use of medicine can deteriorate different body systems. And we all are aware about the antibiotic resistance, which are happening because of the abuse or misuse of antibiotics. And there are many other drugs, especially painkillers. I know if you take painkiller, habituation could be there and you may require a higher doses. So such pitfalls are there. And that is why we say that allopathy is a system which we should use in emergency. It is very well works during emergency situation. And there are few big pitfalls also. Being a practitioner of modern medicine, I have no shame in accepting, because we accept that it has still a limited application. We know that allopathy can treat only 25% of diseases. It does not have cure for muscular dystrophy. It does not have cure for psychosomatic diseases. There are so many diseases for which allopathy doesn't have cure. That is for sure. It can treat only 25% of diseases. And then again, the big issue about allopathy is that it provides you control of disease rather than giving you cure. I'm saying this sentence in reference to non-communicable diseases. Yes, allopathy can provide cure wherever we are dealing with infectious diseases. It can kill infection, but as far as non-communicable diseases are concerned, with which more than 60% mortality is happening world over, it can just control them. It cannot cure them. For example, for hypertension, if you are having high blood pressure, you are being put on a medication which is lifelong. For diabetes, again, the same thing is there. You are put on a lifelong medication, different hormonal diseases. Lifelong medication is the requirement in the allopathy, because that can control your signs and symptoms, but it cannot cure. There is a no treatment available with which we can say that if I give that medicine to a diabetic person, he will be cured or she will be cured. That's not there. So that is a big issue. People taking allopathy, they have to be with those medication for a lifelong thing. And then when people are taking them for a lifelong term, then a lot of compliance issues are there. People get sick of taking medicine. They get so many side effects, and we all know chain of side effects. They are hallmark of many allopathic medicine. Dr. Rao was talking about the chemotherapy. Yes, we know a lot of side effects are there, but when you do not have any other answer, when Ayush therapies, they are not established with the evidences, then you have no choice but to go the allopathic medicine. So that is the situation in our country. But there are some golden aspects also with the allopathy. If I have to talk about allopathy, I would say besides medicine, which is a very small aspect of allopathy, surgery and prevention, there are other two areas where allopathy is doing wonderful. Because if you require a surgery, still allopathic way of doing surgery is a established norm in our country. And what about the prevention? We know how COVID has done for giving vaccination to our population, and that is helping a lot for reducing the morbidity and mortality. So vaccine or supplements or family planning method, I'm just mentioning 2-3 things, because this will give you the idea that prevention has a big role to play in allopathic system also. And we are having around 10 to 12 vaccines available for controlling those diseases as a part of our allopathic system. So where prevention is there, but definitely not to the extent as we know in Ayushpathies. But that is there. So these are the aspects which we cannot deny, which are very good in allopathy system. But when we talk about Ayurveda, all of you are Ayurveda practitioners. So I need not to say much about that. But yes, I would reiterate that we accept that Ayurveda is a holistic natural approach. It brings back the balance or order in the bodily system, and it is compatible to human biomolecules. Because when we take allopathic medicine, that biomolecule is not compatible to the human body. That is why we get so many allergic reactions. That is why we get so many side effects. But but in Ayurveda, we have a biomolecule which is compatible. Most of the time, these products which we take as a food item, so they do not react in our body, and we can easily imbibe them, and we can get cured and heal with those medicine. And then in Ayurveda, we also need yogic procedure. They are part of it, and that improves your spiritual quotient, which is so very important to ensure your complete healing. As Dr. Rao was saying, that in many diseases, because of the anxiety, because of the depression, no patient takes a lot of time to come out of their disease situation. So in Ayurveda, because yogic practices, they are part of it, and that helps you to calm down your mind. That is a very important, you can say, aspect of Ayurveda, which is not there in allopathy. In allopathy, we talk about brain, we do not talk about the mind. And controlling thoughts and keeping your anxieties under control is very important for many of the non-communicable diseases. So allopathies, that's why is able to bring only control, not cure. And then we know Ayurveda is much affordable and feasible in many situations. So these are the plus points. But there are again shortfalls of Ayurveda, which we should also accept at the same time, because once we accept them, then only we can go ahead on improving the practice and research in Ayurveda. Definitely, as Dr. Rao is saying, we do not have enough evidences to practice it, and then it is less practice. Still, if you see in our country, we have many more allopathic practitioners in comparison to Ayush practitioners. And many times I have seen even Ayush practitioners, they have low trust in their own pathies, and they are not willing to, after becoming a graduate or postgraduate, they do not want to practice their own pathies. They say that they would be happy to use allopathic medicine, and they start giving allopathic medicines to patients. And then it further creates mistrust in people. When they see that Ayush practitioners, they are giving allopathic medicine and they do not have trust in their own pathies, and then mistrust also start with the community, and your own colleagues will not trust you. So this issue of low trust is very important, and I would like to urge all the students and interns who are listening me, please understand, you have to have a confidence, you have to study hard, you have to learn your concepts, and once you have learned your concept, you have to confident in using and practicing your own pathy. Don't fall upon allopathy, because that is a different pathy. You can consult, you can refer, but please stick to your pathies, because there you have your hold. then many times it is said that Ayurvedis, they take time, much more time to heal, whereas allopathy is very quick. Uh, um, this statement could be partially true, because I have seen many experts of Ayurveda and Ayush saying that if a right medicine is given, it quickly heal. But by and large, the community feels so that Ayurveda or Ayush medicines, they do take a lot of time. So they then prefer allopathy for emergency situations. And then poor patients, both amongst community and both among our new generation doctors that is there. So many times I have seen Ayurvedic practitioner, or for to say Ayush practitioners, using mingling allopathic medicine with Ayurvedic medicine. I think this is not a right practice, which should be curbed if we wish that our country should excel in Ayush practices. And then there is a big issue of availability of adulterated and contaminated Ayurveda or Ayush drugs. Because Dr. Rao is there, I would like to bring it to his notice that we need to do something about that. See, this is same as in allopathy also. We also get fraud allopathic medicine. But when Ayurvedic medicine, which is adulterated, causes toxicity, then further patient, they loses their trust. So we need to do something about this issue also. So what is the need of how we should go about the whole situation? First of all, again, I would reiterate that creation of more evidences, that is the requirement. And evidences which we want to create should be based on research as per the international standards. Only then your research will be accepted at a national, international, and global level. So that is very important. Third point, which is important, is to need to create labs where yoga or Ayush interventions can be given to subjects and compliance can be ensured. So for yoga, I have seen we need to see that subjects whom we are giving a particular intervention, they are doing yoga. So we need to create such facilities. Then only we can be very sure that yoga interventions, they are being benefited, and that can be documented, which is very important. Nowadays we are depending a lot on technology. So for students, I would say, when you are providing any Ayush or yoga intervention, you can link it with the technology. You can use smart apps, you can use smart mats to ensure whatever interventions you are giving, that is being properly documented and monitored, which is very important for creating real evidences. And then what more important for Ayush doctors is that they get research methodology training as much as possible. For students, they must attend. There are many online courses also available by National Epidemiology Institute. We also conduct many research methodology classes. And once we have established Mind Body Institute, then also we are going to organize such programs where we can train Ayush doctors on research methodology as per the national standards. So students should attend such courses and gain in-depth knowledge of doing research. Then Ayush practitioners, those who are listening to me today, this talk, I would say they must ensure evidence-based practice, because once you are doing evidence-based practice, then you are more confident, you have more trust in your own pathy, and then the community will trust you further. So as Dr. Rao has said about the advancement, now advancements are there in Ayush also. We have Ayurveda genomics, which integrate concepts in Ayurveda, such as Prakriti, with modern genetic research. It correlates the combination of three doshas, Vat, Pitta, Kapha, with the expression of a specific gene and physiological characteristic. So science is advancing, whether it is allopathy or Ayush. And for students to keep pace with it, I must suggest that they must get the exposure of such institutes where such practices are there, and they should also see that how they can advance their own science in different direction. For this, I would like to say, because this seminar is being organized in a medical college, I would urge to all the teachers that for creating or for enhancing the skills amongst the students, they should follow method which is we call as Bloom's taxonomy. Bloom's taxonomy is a method which helps to define your educational objective, which was given by Benjamin Bloom in 1956. According to him, it is very important that we encourage our students to remember. They should work very hard during their UG classes, and they should understand their systems very well, and they must memorize their facts. And then with that level, once that level is achieved, then they should try to understand their subject clearly. What is there? What are the things which are beneficial? Where there is no evidence, they should understand their system, and with the remembrance and understanding, they should try to apply their knowledge, applying the facts, rules, and concept and ideas in different situations. Once they have reached this level of application, they should learn to analyze. So, teachers should give them the opportunity so that they can analyze different situations, and based on the analysis of a particular disease or situation, they should be able to evaluate the given therapy or given treatment. Once they would learn to evaluate the outcome of the therapies, then they can also plan their own therapies. They can create new therapies. So this should be the way how students should be taught from first year of their undergraduation. I would like to say that first three levels, remembrance, understanding of subject, and learning to apply, this is very much applicable for undergraduate students. And for postgraduate, besides these three levels, they should be taken up to this level of creation, where they are able to think and create treatments for the different diseases. So we are talking a lot about research. Again, for the sake of UG students, I would like to define, they must understand what is research. It is not just replicating the existing research. Research is a scientific in nature. It's a systematic, controlled, empirical, and critical investigation of natural phenomena guided by theories and hypotheses about presumed relation among such phenomena. So research is something which should come out from your situation, which has some translational value, and which can bring some positive results to be applied for the betterment of the mankind. When I say positive result, there is a situation that you can get a negative result. That is also acceptable. So one should not feel discouraged if you do research and you do not get a positive result. So research is just a scientific and systematic phenomena. It is not a random activity. And what is science? When we talk about so much of science and creating evidences, now you should understand, in science, there are three very important steps. Whenever you will plan any study, there are three important steps you should not forget. First is establishment of intelligent hypothesis. Means your research question should come out from an intelligent observation. Suppose you want to say why there is a rise in the lunatics during a particular phase of lunar cycle. So if that is a question, then you have to systematically analyze your hypothesis, whether your hypothesis is right or wrong. And then once you have understood that your hypothesis is right, then you have to collect your observations systematically to prove whether your hypothesis is correct or not. And once you have done those systematic observation, which we call experimentation, then whatever results you have brought in should be replicable to other places. Suppose if you have done some study in Bangalore in your college, and you say that this therapy is useful, then if the same methodology I use in my institute, I should be able to get the same result. That we call as replicability or universality. So until unless your outcomes are replicable, world is not going to accept. That's what Dr. Rao was talking, that we have to do multi-centric studies. That is the importance of doing multi-centric control trial, because until unless your outcomes, your findings are applicable, replicable, they are not going to be accepted by the world. I have seen many Ayush practitioners, they say that they have some hidden or secret therapy with them, which if they will give to a patient, then only patient will be cured. So science will not accept such a statement. Science is not going to accept such people who have some secret therapies which can be applicable only if they give. So just be aware of such situation. Science or modern science will not accept such claims. Now, evidence-based medicine, we are talking again and again by evidence-based medicine. So you should also understand what is evidence-based medicine. It is integrating individual clinical expertise and best external evidence. What are the advantages? It has a potential to improve quality of patient care. It helps to identify and promote practices that are scientifically proven to be effective. It identifies practices that are ineffective or harmful also. So it's not always positive things will come out. You can come out with the result that this particular therapy is harmful and should not be given. That is also a very good result. And then evidence-based medicine helps to promote critical thinking. It requires that clinicians should be open-minded, and it encourages researchers to focus on evidence and outcomes that are important to clinician and patient. So sometimes there could be a possibility that you say that your research is trying to bring out some result, but if it is of no clinical value, then also that will not be accepted. So please ensure evidence-based medicine. So what is the modern poem? So we are talking about evidence-based medicine. We are talking about science. We are talking about trials. So what is our poem now based on this? Poem is actually patient-oriented evidence that matters. So whatever we are talking about, creation of evidence-based medicine, personalized medicine, nano medicine, or what not, what is going to matter? Only those evidences will matter which are directed, beneficial, feasible for a patient. Now, level of evidence already discussed by Dr. Rao, but again, for the sake of interns and UG students, I will emphasize, see, in science, in modern science, expert opinion is kept at the bottom. It has very lower level of quality of evidence. What matters is the randomized control trial, and at the top of the pyramid is systematic reviews and meta-analysis of RCTs. So highest level of evidence is systematic reviews and meta-analysis of RCTs, randomized control trial. So all of you should try to start your journey of research career from, I would say, cross-sectional studies. You can go to case control, then you can conduct cohort, then you learn to do randomized control trial. But ultimately, Ayush practitioners, Ayush postgraduate student, Ayush PhD student, they must start doing randomized control trial and meta-analysis if we want to create high level of evidences to establish this Ayush pathies at a global level. So what is the gold standard? Again, I will emphasize. So finally, gold standard is double-blind randomized control trial, which all students of Ayush practitioners must try to attempt if you have an interest in this area. Now, I would like to brief what I have done in my institute to synergize Ayush with allopathy, because AIMS is essentially a allopathic system. So Government of India under the PMSSY, Ayush department was also established. So when 4 years back, when I was given charge of Ayush system, that time I was not knowing much about Ayushpathies. And then at that time, when I met with Ayush doctors, I have realized they have so much to offer to world. But because they do not have evidences, that is not getting accepted by my allopathic colleague. So what I have realized that it is very important that medical or allopathic practitioners must understand about Ayush. Then only they can come in sync, and they can start the hand holding of Ayush doctors for doing research. So with this intent, I had started a 21-hour course of introductory course on Ayush for our allopathic medical undergraduates, and now they are studying, so that at least they develop some kind of understanding of Ayushpathies, and they can refer their patients if they come to know that allopathy doesn't have anything to offer to them. And then after that, I have organized different seminars and many other conferences there in the institute related with Ayush. And with that, faculty slowly and slowly started doing projects in Ayushpathies. I would like to just give you some idea that one of my faculty, Dr. Anisa Atif Mirza, who has helped me to develop this presentation. She's doing a very interesting study about efficacy of customized protocol of holistic traditional complementary alternative medicine to implement for assessment and improvement of immunometabolic, clinical, and psychosocial outcomes in suspected isolated cases of SARS-CoV-2. So this is a pilot randomized controlled trial which she is attempting. Then we have Dr. Ruchi Dua. She is a pulmonologist, and she has recently completed a study on Gayatri Mantra and Pranayam as an added tool in COVID management, and she has found very positive results. And she has come out that alternative therapies can be add on to conventional usual treatment for various diseases. And she has also given this hypothesis that Gayatri Mantra may have potential pathways which include inflammatory mechanisms. So this is the hypothesis which has come out from her study or exploratory randomized trial on Gayatri Mantra and Pranayama. Besides that, we are also having many other departments, general medicine, my own department of community medicine. They are doing different researches related with Ayush and yoga therapies. Just to give you some example, that one study being done by general medicine about the Prakriti profiling among hypertensive subjects. Then we are doing effectiveness of RV treatment in patient with Urgvad Amlapitta, which is an exploratory study. So such studies are being conducted by allopathic practitioners in conjunction with Ayush doctors. So I have a list of projects and proposals which we are conducting at the moment in the institute. So that includes related with Sudarshan Kriya, COVID-19, use of herbal treatment in COVID-19, and many others. Especially you can see efficacy of yoga therapy versus lifestyle modification for management of polycystic ovarian syndrome. So such studies are going on in our institute. Many PhD theses are also going on in our institute, which are related with different Ayushpathies. So I would suggest that in every year we open call for students to apply for the PhD in our institute. So whosoever is interested, they can visit our website. Whenever there is a call, there is an entrance examination, and there after entrance examination there is a interview based on a student gets selected for the PhD course. So whosoever is interested, they can come forward, and we take a student for different Ayushpathies. Then our allopathic doctors, they are integrating yoga a lot in their clinics. I would like to tell you about Dr. Monica Patania. She is a physician in our institute, and as per her experience, she says that she has been using yoga as a lifestyle modification practice in her clinic for the patients of diabetes and hypertension and metabolic syndrome. And she has experienced that patients are doing better with the different yoga therapies, and their usual medication and usual term for the disease has been reduced. So Ayush is being, or especially yoga has been used a lot in our institute. Then recently, with the help of Council for Research in Yoga and Naturopathy, CCRYN, we have established Center for Mind-Body Medicine. And basic idea for the establishment of this mind-body medicine is that we can increase research in Ayush therapies, and we can also train and educate different Ayush practitioners in the international standards of research. That is our main aim. Also, we want that to sensitize physicians, research scholars, and students from modern medicine and Ayush streams in mind-body medicine. And we want to also create a scientific culture in our institute so that collaborative researches with Ayush can also happen. So I would like to say, now new paradigm is that we should not feel that who is going to win the race. We should collaborate with each other so that we both can win. At the end, before concluding my talk, I would like to tell you, Ikigai is a Japanese principle. It is a Japanese concept which gives you the idea for reason for being in this world. So for students, it is very important that you should understand what you love doing, what you are good at, what you can be paid for, and what the world needs. So because what you love and what you are good at is going to give you the idea about your passion, and what you are good at and what you can be paid for is going to give you idea about your profession you should choose. And then what you can be paid for and what the world needs would give you the idea about vocation, and what the world needs and what you love, that is going to give you about the mission. So please identify your passion, mission, vocation, and profession to get the idea of why you are here in this world. See, everybody cannot become a researcher, everybody cannot become a teacher, everybody cannot become a patient carer or physician. So please choose your profession wisely, choose your passion wisely, and if you choose to be a researcher, please get yourself trained well and contribute to creating more and more evidences for the society. Thank you so much for the patient listening. Thank you so much. That is all from my side.
Thank you, Dr. Monica Saxena, for providing information regarding advantage of integrating medical system over allopathy for normal usage, and also for psychosomatic disorder and non-communicable disorder and prevention of certain diseases. And also the advantage medicine. And what are the shortfalls are there in Ayush system with respect to less evidence and adherence, etc., which can be overcome through the research with multi-centric trial. And can be also providing information regarding Bloom's taxonomy for science and systematic review and meta-analysis with respect to its importance. And what is the requirement to strengthen our scholars with respect to providing the standard training and encourage them to take up the multi-centric trial. And also, I congratulate Madam to steps taken to integrate RE system with other system of medicine at your college. Once again, I express thank you, ma'am. We will have a short 5 minutes tea break and we will join back to next session. I hand over mic to Unnati volunteer.
Namaste. I want two volunteers, one who are having any small pains, knee pain, ankle pain, or any joint pains, and another person who are having a refractor, who are having glasses. Two volunteers. This is for to show or light demo how the yogic feeling works. Anybody want to experience it? And if you are willing to let go of your problem, you are welcome. I want two volunteers. One who are having pain, another who are having stress. We'll try together. Who wants to come? Two people. Yes. So one is ready, another one person who are having any pain.
Is the period of transition from childhood to adulthood, and it plays a decisive role in the formation of pro-social or anti-social adult. At this stage, they need acceptance, support, and guidance. Most of the time, understand them. That is why the present young community is open only to their peers. Rajiv Gandhi University of Health Sciences supported Unnati to approach medical colleges and to sensitize the medicos in this regard.
I'm really pleased with the work Unnati has been doing. something to awake humanism in you.
Social relevance cannot be taught within the four walls of any medical college. Please take this exercise seriously.
ಡಾಕ್ಟರ್ ಸರಸ್ವತಿ ಅವರು ಇವತ್ತು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮತ್ತು ನಮ್ಮ PU ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಅನ್ನ ಒಂದು ಸಂಗಮವನ್ನ ಮಾಡಿದ್ದಾರೆ. ಇದು ಖಂಡಿತವಾಗಿ ಮುಂದಿನಗಳಿಗೆ ಹಾಗೂ ಎಲ್ಲಾ ಕಾಲೇಜಸ್ಗಳಿಗೆ ಮೆಡಿಕಲ್ ಕಾಲೇಜಸ್ಗಳಿಗೆ ನಾವು ವಿಸ್ತರಿಸೋಣ.
This program Unnati Healing Foundation, it was so superb and I shared everything.
ಈ ಪ್ರೋಗ್ರಾಮ್ ನನಗೆ ತುಂಬಾ ಇಷ್ಟ ಆಯ್ತು.
The best part what I liked about this movement is the message of spreading love and happiness.
I'm happy that I'm doing something for social change. I started to enjoy myself and learn to put myself in their shoes.
ಅವ್ರ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ನ ಹೇಳಿದ್ದಕ್ಕೆ ನನಗೆ ಇನ್ನೂ ಸ್ವಲ್ಪ ಪ್ರಾಕ್ಟಿಕಲ್ ಆಗಿ ಅದನ್ನು ಹೇಗೆ ಅಪ್ಲೈ ಮಾಡಬೇಕು ಅಂತ ಗೊತ್ತಾಯಿತು.
Today is indeed a remarkable day for me. We were never counseled one-to-one before.
Actually came today with helping people. Yeah, I was cured, man. When you help others, you will be helped. That's what he told and that's what happened.
I congratulate Unnati Healing Foundation for having conceptualized the whole idea. And as an university, Rajiv Gandhi University of Health Sciences has always been supportive of such activities. And I would assure you that whatever you would come forth with whatever program to take this forward, I am there to help you out. And I'm sure I can give a word on behalf of all my students that they will also participate and make this program a great success.
Congratulate the team of Unnati for rebuilding, awakening India. I hope that their mission is successful in getting youth to come together for this mission.
We have to utilize the power of youngsters to bring a transformation in our country. They are capable, they are energetic, they are willing. They need a proper channel to serve. We are all here to provide that opportunity. Changing and making our country a healthy country is not a difficult task. Population is our strength. Adolescence is the period of transition from childhood to adulthood, and it plays a decisive role in the formation of pro-social or anti-social adult. At this stage, they need acceptance, support and guidance. Most of the time, parents and teachers fail to understand them. That is why the present young community is open only to their peers. Rajiv Gandhi University of Health Sciences supported Unnati to approach medical colleges and to sensitize the medicos in this regard.
I'm really pleased with the work Unnati has been doing. Something to awake humanism in you.
Social relevance cannot be taught within the four walls of any medical college. Please take this exercise seriously.
ಡಾಕ್ಟರ್ ಸರಸ್ವತಿ ಅವರು ಇವತ್ತು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮತ್ತು ನಮ್ಮ PU ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಅನ್ನ ಒಂದು ಸಂಗಮವನ್ನ ಮಾಡಿದ್ದಾರೆ. ಇದು ಖಂಡಿತವಾಗಿ ಮುಂದಿನ ದಿವಸಗಳಲ್ಲಿ ಎಲ್ಲಾ ಶಾಲೆಗಳಿಗೆ ಹಾಗೂ ಎಲ್ಲಾ ಕಾಲೇಜಸ್ಗಳಿಗೆ ಮೆಡಿಕಲ್ ಕಾಲೇಜಸ್ಗಳಿಗೆ ನಾವು ವಿಸ್ತರಿಸೋಣ.
This program Unnati Healing Foundation, it was so superb and I shared everything.
ಈ ಪ್ರೋಗ್ರಾಮ್ ನನಗೆ ತುಂಬಾ ಇಷ್ಟ ಆಯ್ತು.
The best part what I liked about this movement is the message of spreading love and happiness.
I'm happy that I'm doing something for social change. I started to enjoy myself and learn to put myself in their shoes.
ಅವ್ರ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ನ ಹೇಳಿದ್ದಕ್ಕೆ ನನಗೆ ಇನ್ನೂ ಸ್ವಲ್ಪ ಪ್ರಾಕ್ಟಿಕಲ್ ಆಗಿ ಅದನ್ನು ಹೇಗೆ ಅಪ್ಲೈ ಮಾಡಬೇಕು ಅಂತ ಗೊತ್ತಾಯಿತು.
Today is indeed a remarkable day for me. We were never counseled one-to-one before.
Actually came today with helping people. Yeah, I was cured, man. When you help others, you will be helped. That's what he told and that's what happened.
I congratulate Unnati Healing Foundation for having conceptualized the whole idea. And as an university, Rajiv Gandhi University of Health Sciences has always been supportive of such activities. And I would assure you that whatever you would come forward with whatever program to take this forward, I am there to help you out. And I'm sure I can give a word on behalf of all my students that they will also participate and make this program a great success.
Congratulate the team of Unnati for rebuilding, awakening India. I hope that their mission is successful in getting youth to come together for this mission.
We have to utilize the power of youngsters to bring a transformation in our country. They are capable, they are energetic, they are willing. They need a proper channel to serve. We are all here to provide that opportunity. Changing and making our country a healthy country is not a difficult task. Population is our strength. Adolescence is the period of transition from childhood to adulthood, and it plays a decisive role in the formation of pro-social or anti-social adult. At this stage, they need acceptance, support and guidance. Most of the time, parents and teachers fail to understand them. That is why the present young community is open only to their peers. Rajiv Gandhi University of Health Sciences supported Unnati to approach medical colleges and to sensitize the medicos in this regard.
I'm really pleased with the work Unnati has been doing. Something to awake humanism in you.
Social relevance cannot be taught within the four walls of any medical college. Please take this exercise seriously.
ಡಾಕ್ಟರ್ ಸರಸ್ವತಿ ಅವರು ಇವತ್ತು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮತ್ತು ನಮ್ಮ PU ಕಾಲೇಜ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಅನ್ನ ಒಂದು ಸಂಗಮವನ್ನ ಮಾಡಿದ್ದಾರೆ. ಇದು ಖಂಡಿತವಾಗಿ ಮುಂದಿನ ದಿವಸಗಳಲ್ಲಿ ಎಲ್ಲಾ ಶಾಲೆಗಳಿಗೆ ಹಾಗೂ ಎಲ್ಲಾ ಕಾಲೇಜಸ್ಗಳಿಗೆ, ಮೆಡಿಕಲ್ ಕಾಲೇಜಸ್ಗಳಿಗೆ ನಾವು ವಿಸ್ತರಿಸೋಣ.
This program, Unnati Healing Foundation, it was so superb and I shared everything. ಈ program ನನಗೆ ತುಂಬಾ ಇಷ್ಟ ಆಯ್ತು.
The best part what I liked about this movement is the message of spreading love and happiness.
I'm happy that I'm doing something for social change. I started to enjoy myself and learn to put myself in their
Namaste. Happy to share about Unnati Healing Foundation. In 2001, we have established Unnati Healing Foundation, and since then, it is really addressing the needs of different strata of the society. Every day, personal stress, professional stress, family stress is causing lot of various kinds of
health challenges, relationship issues. What do we do for that? Other than taking medication or visiting psychiatrist or some other support, are we really doing something to work within? Whatever the materialistic comfort you have in your life should be supported within with the peace, calmness, happiness, contentment. Then there is a meaning for this materialistic comforts. That is not taught in school, that is not taught in any of the organizations. That is taught in Unnati Healing Foundation. We heal health related issues. If a person is going through medication or any surgeries, we have to energize their energy level so that they balance energy, they balance their emotional status. The whole family can come together and face the challenge. The recovery will be much faster. Success rate will be much higher. The repeated illness causes lot of damage to the family. Medication can fix only the symptoms most of the time. Yogic healing can help you to come out of those challenges. It builds the inner strength. Inner healing power can be enhanced. The family can be a better place to lead a better healthy life. Even at old age, students with education, the fear, stress, energy level can be very well handled through yogic healing. We offer different kinds of services. First part is healing. When a person is going through a health crisis, maybe they may be able to come to Unnati or they may be sick at home or hospital, Unnati will support its healing hand to the person wherever they are. That is the beauty of yogic healing. It's a yogic power. Second part, if a person is going through a lot of stress and they know this stress is causing stress related health problems little later, they can prevent it at that stage. If already got affected by the diabetes, blood pressure, arthritis, migraine, it can be very well healed, managed. You can prevent all further damages. Maybe 50 years back, people were talking about the importance of education. Now we need to talk more about inner health. Inner health through yogic healing. Last 20 plus years of our existence, we have done extensive research on cancer, on diabetes, on blood pressures, or children related issues. It fantastically heals. Also, we did a lot of work on eyesight management, vision without glasses. It just fixes whatever the problem you name it. There is a solution through yogic healing because it works and deals with the inner energy level. Once your inner abilities are, it is wise thing to take a decision to create one healer for each family. That is very important. Educate your children to take care of self-healing. Namaste. Happy to share about Unnati Healing Foundation. In 2001, we have established Unnati Healing Foundation, and since then, it is really addressing the needs of different strata of the society. Every day, personal stress, professional stress, family stress is causing lot of various kinds
Good afternoon. I request all the delegates to utilize the opportunity given by Unnati Foundation by listening keenly and recording the content delivered presently. It's an humble request. Now, I invite Dr. Saraswati Hegde, a speaker, researcher, spiritual scientist, and a writer, and founder of Unnati Healing Foundation, to address the gathering on the topic Yogic Healing, the need of therapy for holistic health. Over to you, ma'am.
Thank you. Good morning. Good morning. Am I audible? Yes. Would you like to tell good morning to yourself? Good morning. That's wonderful, wonderful. Now, let us move on with the topic. Why do we need holistic therapy? What is well-being? Have you ever thought that your complete existence, realize your complete existence? Your Ayurveda talks so much about wellness. Have you ever related to yourself? We know, we studied so much about yoga or heard so much about yoga. Breathing is very good, pranayama is very good. I could see a lot of restlessness among each one of you. Why can't we try one deep breathing? Can you do that? Yes? Please. To do a proper pranayama, the mouth should be closed first. Yes? Please. Okay. It's a wonderful privilege for me to be here with all the experienced stalwarts sitting here. And morning 2 talks you heard about the importance of doing this work. Our Prime Minister talks so much about outside. In the entire world population, among 6 people, 1 will be in India. If the Indians are not aware of their own healthcare system, who can talk about this to the world? Isn't it? We have a lot of responsibility to bring a good health in the world. Next slide, please. Let me just brief you about. Should I use this? Okay. Yeah. I'm going to share a very brief introduction about yogic healing, right demonstration of healing, and our research evidence, whatever I'm sharing today. Next one. Thank you. Let us understand. You all might have studied the physical, mental, and social well-being, not merely the absence of disease or poverty. Also, it is extended. Spiritual well-being. It means WHO talks about various aspects of health, not just a physical well-being or physical health. Shall we correlate with our earlier tradition, the approaches? Do you remember these Panchakoshas? We use, there is no touch or no drugs given. Through the energy, healing will be done. And ancient science, that is Panchakoshas, mentioned in Taittiriya Upanishad. We have different koshas. Let us see this picture. Whenever I share some information, try to relate it with your own system. These information for not for others, it is to implement within first part. Okay, physical body. Annamaya kosha. What comes to your mind about your own physical existence? What is the health you have in your physical body? Then comes the pranamaya kosha, energy body. That is, we talk so much about prana. Prana pakshi, pancha prana, prana koitu, prana bantu. How much do we know about prana? Right? Then the mental body, manomaya kosha. We have emotions, we have thoughts. Also, the wisdom. In Sanskrit, the Upanishad clearly discriminates between the mind and the wisdom. We should learn to understand this. Now, we can look at this as a physical Annamaya kosha. What do we need to provide? Food, exercise, sleep. These are the basic things required. If people are not taking care of these basic things, then the medication comes. Other physical therapies comes. If we can help people to take care of their physical body well with these fundamental things, the last one, not much required. This is Pranamaya Kosha. We talk so much about aura, chakras, and the nadis. These things are in the Pranamaya Kosha. Just a simple pranayama. If pranayama is not working, take a healing. Or yogic practices also can influence on your aura. Make sure you have a strong energy body. What do you mean by strong energy body? Have you noticed sometimes your friends comes with a lot of happiness? You say, you are looking very good today. You are not admiring only their dress. You talk about their energy, isn't it? Sometimes you feel so energetic. They have so much of energy. How do we sustain that energy all the time? How do we make sure that our chakras and energy body is healthy all the time? I don't want to elaborate much. There was one more in Chandogya Upanishad. There is one, information shared that there was an ego fight between sense organs. Everybody says, like, we all of us have ego fights, right? I am great, I am great. Then finally they decided to leave the body for a day, or for a year, and then come. 1 year, I was not present in the body. Then 1 year for year. The final term came for prana. What should be the answer? If 1 year prana goes out, the whole system collapses. Then everybody said, don't go. We are so much lost in medication, treatment. We are not addressing the basic things. That is the life force. Till we have life force with us, we have existence. Once it goes, nothing. It is like a human software. We should learn to handle that. We should learn to manage it. During my exams, I need elevated energy level. I should know how to make it. Stressful situations, challenging situations, we must learn to enhance ourselves in our energy body. If these basic things given, because it's no drugs, no medicine, it is within us. Where is pranic energy? It is all around us. Just a simple technique to download the energies which is around us. That we deal in healing. Next comes Manomaya Kosha, thoughts and emotions. Most of the time we struggle in this kosha. Right? How much confusions, disturbances we all of us go through. If your mind becomes very clear, focused, your learning process becomes very clear and application becomes powerful. That we need to treat each body with its own requirements. By treating that, your mind becomes more clear. Sorry. Okay. love, care and kindness and forgiveness required for the emotional body. I'm just giving a very few words. If a person won't get the love, care, people may be having all facilities in their life, all great things in their life, but without love, without care, people tend to commit suicide because of confusions. Why it is required? It is not required. If the method is taught to us how to make our mind clear, how to enhance our emotions better, very simple things can heal us. The next is Vijnanamaya Kosha. Wisdom is required. What is the difference between ordinary person and the successful person? Their wisdom oriented life. They can see things clearly, they can take decisions. Their thinking is different about you say that. In any competitive exam, what is the difference between the successful students and the ordinary students? Everybody has studied the subject a similar way. Those students, they get some flash. Their success will be much higher. If you know how to achieve the wisdom kosha, little more, nothing like that. Do you need any prescription for that? Not required. These informations are with you. Regular meditation, every day invest on yourself. Introspection. What was my day for today? What is required to develop myself? What is that I can delete? We know how to make the mobile manage, right? If the space is too much occupied, we delete it. Why can't we learn the method to delete unnecessary things through introspection? Calmness and stillness. The fundamental things we have not adopted. Our education system is making us competition. Think. That is not the way. Wisdom is ultimate. It is intuitive approach. Your smartness is possible through intuition. Learn something to enhance your intuition level. The last one is Anandamaya Kosha. What do you see when you look at all these photos? While taking a selfie, we smile, we make our mind calm and face very calm. Right? Otherwise, during your anger, your irritation, your daily routine at the home, if some CC camera is recorded, what kind of photos we can get? How do we move ourselves to these levels? Do you see that last photo of a baby smiling? Can you relate it? There is an inner child within all of us. We all of us have come from that stage to this. Instead of retaining our smile, happiness, bliss, joy, who asked us to cultivate all this stress? Isn't it? Think about it. When we start keeping that inner child alive, that joyful child alive, can you just do one simple experiment within you? Just smile about yourself. Think of one good thing within you and just smile. Try to activate this baby within you. Something good about you. Do you see the difference? Is there a difference? Yes or no? Anybody can answer. If yes, say yes. Or like this. Not sure? No. Can everybody respond? Do you see any difference? If you are not seeing any difference, you are not smile at your child within you. Try it again. Because we have forgotten to reach out within, to get connected within. Unless and until we get connected within, we can't experience the joy of life. From the childhood, this is how I have learned. Maybe you also. ಚೆನ್ನಾಗಿ ಓದು, ಒಳ್ಳೆ ಮಾರ್ಕ್ಸ್ ಬರುತ್ತೆ, ಒಳ್ಳೆ ಕೆಲಸ ಸಿಕ್ಕತ್ತೆ, ಆಮೇಲೆ ಚೆನ್ನಾಗಿರ್ಬೋದು. Right? ಹೌದಲ್ವಾ? Have you made a list of people? ಚೆನ್ನಾಗಿ ಓದಿ, ಚೆನ್ನಾಗಿ ಕೆಲಸ ಸಿಕ್ಕಿ, ತುಂಬಾ ಸಂತೋಷವಾಗಿರೋಲ್ಲ, including your parents? Have you seen? That is not the path of happiness. That is not the path for joy. Of course, it is required to fulfill the nurturing for your mental body, Manomaya Kosha. But Ananda is sustaining the divine gift which has come with us by birth. Sustaining that joy is important. Will you make a commitment to yourself to sustain that? If your ananda is high, your wisdom, that is Vijnanamaya Kosha, you will be more intuitive. If your intuition is high, your mental body, your thinking, your emotions will be more clear, more focused. If your mental body is very clear and focused, your energy will be always very high. If your Pranamaya Kosha is very good, your physical health will be good. It is vice versa. Okay. Now, how do we, I'll just show a simple demonstration. How do we do the treatment, since it's a new concept, energy concept? Dr. Raghavendra was mentioning about Reiki. Reiki is in general combining all different energy therapies. How it is done? Okay. So here, since I talk so much about no touch, no drugs. Energy is all around. How do we do that? I think these people have come forward as a volunteers. Just before the tea break, it was announced to have come, and I request two healers to come quickly on the stage to do that. This is what is called research. We have documented this works with everyone. If I do this, it works. If they do it, it works. Getting a little training, and if you do it, it works. Okay. Now, one of the sessions in Mysore, when I was demonstrating about eye therapy, it is much 10 years back. Way back. There was ophthalmologist. He witnessed this. And he said, it is not possible to change the vision instantaneously. I want to document this. I don't want to believe this. We documented. That is how the research started. What we do, we start scanning the energy. Healing, the training is making the healers to become sensitive with their energy, hands. Our hands are like a scanning machine. How you check nadis and diagnose. Similarly, healers are trained to feel the energy. They sense the energy. Example, if somebody has a pain, what it indicates, that particular energy field. Example, if I have a, since you can see, if I have a pain here, okay, pain in my hand, the aura around the hand will be affected. The energy flow is not smooth. If the energy flow is not smooth, how to identify? You feel heaviness, you feel tightness, you feel discomfort or pain. Gradually the disease starts. Most of the time disease won't come immediately. Other than accidents, even the heart attack will not happen immediately. It might have gradually built, the aura is affected. What they do, what is the quality of energy around the painful area, intensity, we check, the training is given to that. Then based on that, we start releasing it, taking it out, putting it into water and salt. We will not throw it here and there. After taking all the disease used up energies and putting it into salt water, the energy will be replaced. What is that patient is supposed to do? They are supposed to relax, practice deep breathing, be willing to get healed. Healing is an inner process. Healing is an inner process. When you allow it, it happens. When you are ready for healing, it will work. Even in a medication, right? So that willingness should be enhanced. That is what, while doing the healing, they work on the energy field. It works on the physical body, that is Annamaya Kosha. Because their mind becomes more clear, it works on the mental body, that is Manomaya Kosha. When the mental body is clear, their wisdom, their inner guidance starts coming to them and they experience peace. That is bliss. By treating Pranamaya Kosha, all other bodies can be healed. Clear? So, that Dr. Sharath has spoke to them regarding their ability to see. When pain scale is measured, after the therapy, they will check it again. So this is what will be done as a healers. This will be done directly. A lot of patients come to take the support. Sometimes students, they can't manage their stress. they will come. It can be done directly and distantly. You know why I am here today? I have seen in my personal life, family life, and my surroundings, crisis comes to everybody's life one or the other. Is there anybody who has not experienced disease or crisis? Anybody? Please raise your hands. What is our response towards such situations? Internally, you tend to feel panic. Instead of that, these kinds of empowerment can help us to manage things. Since we realize that I am responsible for my good health, I repeat, who is responsible for my good health? Now we have given the image that doctor is responsible for treating patient. Of course, they can give a medicine, but to utilize the medicine, the patient should be ready. We are responsible for our good health. We have to put in effort. Okay? So that is how the healing will be. That hope you can see and understand. They feel, they sense, and they release the business energy into the salt water. Then they be pleasant. I'll just share one why we started with India. One of the experience, then I proceed. There was a day I was entering just 2 days before the Deepavali festival. Okay, once we are healer, people will be aware around us. Just entering the mall for shopping, got a call. One of my known contacts, she called. I knew that we were trying to help her. Very family violence. She was pregnant. She called me. I cannot take this violent environment anymore. I have decided to conclude my life. Phone disconnected, switch it off. Many times, as a healers, we all go through these situations, helplessness. You have only one tool to apply, healing. I found the place nearby, did my part, maybe it took 10 to 15 minutes. Tried calling her back, there was no response. I was very clear, I have done my part. Then after 2 days, I got a call from her. I'm feeling much better. Persistence in your work, clarity and focus in your application is extremely important in any situation. Okay, so before they leave, people are very curious to talk to you. Please come. Isn't it? Yeah, please come. Your name?
Dr. Sandra.
Okay, what was your discomfort?
I was having traffic in the right eye.
So you got healed for your eyes or pain?
Eyes.
Eyes. Okay. Now can you please check and come back? What about her? Okay, can you please come? Yeah, please introduce yourself and share.
Myself, Navya. I had mind ankle pain, and now before the treatment, when they checked, it was around 3 in the pain scale. Now, actually, I'm not feeling any pain. I feel a lot of relief.
No magic. This works based on the science. There is no magic. It works on the principles. I just showed you. Now, when we do the treatment, if she needs some strengthening part, support for her muscles, then the medication can come in. Then the other therapies can come in. Healing can go hand in hand with other systems. Now, let us share some of the research activities what we have done at Unnati last few years. Some of the publication also we have done. Please. Audio, please. Audio. Audio ಕೇಳಿಸ್ತಿಲ್ಲ. ಶರತ್ ಸ್ಲೈಡ್ ಶೋ ಅದರಲ್ಲಿ ಪ್ರೆಸ್ ಮಾಡಿ ಸ್ಲೈಡ್ ಶೋ. Sorry for the inconvenience. Technology is something like our mind. Sometimes ಕೈ ಕೊಟ್ಬಿಡುತ್ತಲ್ಲ, ನಾವು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡಿದ್ರೆ ನಡ್ಕೊಳ್ಳೋದೇ ಇಲ್ಲಲ್ಲ. We should learn to equip, have patience. Okay. Meanwhile, I'll share one more information. During pandemic, we from I think from Andhra Pradesh, one of Hyderabad, one healer's relative was very severely affected by COVID, and the situation was very critical. They took a support of almost 42 days later, patient recovered. Every day we used to get a call, persistently healing, not without any giving up. In between, patient condition is to be very critical. Medically, it is not so easy to come out of that condition. One more, I'm just sharing the COVID. One of the PG student in one of the national importance college was going through very critical condition. When his classmate shared the X-ray, he was shaken. Almost I'm losing my classmate, my co-PG. That pain and fear was so much. We started the healing intensively, and the end result has come out of all those problems. Lot of people ask me, it means you have one
Greetings to all the speakers and participants. I'm Dr. Nisarg Arvindan.
ಮೃತ್ಯು ದೇವತೆಯನ್ನ ನಾವು ಗೆದ್ದಿಲ್ಲ, ಪ್ರಾಣ ದೇವತೆಯನ್ನ ಓದಿಸ್ಕೊಳ್ತಾ ಇದ್ದೀವಿ. Right?
Greetings to all the speakers and participants. I'm Dr. Nisarg Arvindan, Junior Resident in Department of Community and Family Medicine, AIMS Rishikesh. The topic of this presentation is Yogic Healing, the Need of the Hour for Holistic Health, where we'll be talking about Greetings to all the speakers and participants. I'm Dr. Nisarg Arvindan, Junior Resident in Department of Community and Family Medicine, AIMS Rishikesh. The topic of this presentation is Yogic Healing, the Need of the Hour for Holistic Health, where we'll be talking about our experience in yogic healing for holistic health, a research perspective. The contents include direct healing, distant healing, healing through materials, healing through mantras, prayers, meditations, and positive affirmations. Direct healing is when we recommend patients to opt for their choice of therapy in case of acute and critical conditions where we will not interfere in the regular treatment. The healers will work on the energy field and the patients will be present in front of the healer and they will be guided and monitored one-to-one periodically. Research through direct healing includes healing in asthmatic children, eye healing, role of its effect on blood pressure, in stress management in children, in reducing blood sugar levels in diabetics, and on modulating inflammatory response during strenuous exercise. Healing in 18 asthmatic children was done for 3 times a week for 3 months, and it showed statistically significant improvement in FVC by 12.5% and FEV1 by 11.8% with reduction in episodes of asthma. Here is a bar graph comparing the lung capacities before as well as after healing. 25 patients underwent yogic healing for refractive errors on alternate days with 15 sessions and with regular eye exercise for a period of 30 days, where 7 patients had complete resolution of refractive error, with 2 patients having marked improvement of 80 to 90% and 9 patients having moderate improvement ranging from 60 to 80% of their original refractive error value. Among the 9 patients, 6 had improvement by more than 1.5 diopters, 2 had improvement by more than 2 diopters, with 75% of astigmatic patients having normalization of vision. This is a graph with the compiled improvement. Comparison of plasma TNF alpha in females and males between yoga and non-yoga groups were done, where the yoga group had lower levels of TNF alpha levels compared to the non-yoga group. The strenuous exercise increases the TNF alpha in both groups, but proportion of increase is less in yogic practice group than non-yoga group. Thus, the practice of yoga with physical activity, breathing exercises, and meditation will keep pro-inflammatory levels at a lower level. Role of healing in stress management in children was also assessed, where 29 students of 7th grade underwent physical exercise, breathing exercises, invocation, chanting, and healing every day for 10 days, with a statistically significant reduction in stress levels, increased academic performance, and better physical strength and stamina. The p-value of perceived stress scale and teacher's Rutter's scale are seen to be significant here. Healing also helped lower the blood pressure of medical students with a parasympathetic dominance of the autonomic nervous system. Another study showed reduction in the blood sugar and HbA1c levels in type 2 diabetics who underwent yogic healing, who were also on OHAs, compared to control groups who were only on oral hypoglycemic agents. Distant healing. It is a mode of healing when the patient is not physically present in front of the healer but can undergo healing with the same effect and quality as of direct healing. It works on two principles, namely the principle of interconnectedness, which says that the energy is like the air, that we are connected to one another with the common energy of the earth. Second is the principle of directability, with the concept that energy follows thoughts and intentions, as in when the healer focuses his or her energy with particular thought and intent to a patient, the diseased energy is cleaned and fresh energy is projected to the affected area. This is commonly used for situations where patients can't be present in person, like road traffic accidents, cardiac arrest, domestic violence, suicidal tendencies, exam fear, panic attacks, among others, where it can be compared to first aid. Research has been done, including on COVID healing, case study of COVID in a medical student, in road traffic accident patients, and patients with cardiac arrest. So COVID-19 healing, which include breathing exercise and yogic healing done on the basis of COVID severity. The findings have shown faster symptomatic recovery, mean increase in SpO2 values, and faster reduction in oxygen requirement, with only 3% having post-COVID symptoms. Healing through materials is present in all treatment modalities, the RX symbol in modern medicine and the gratitude towards Ashwini Devatas in Ayurveda. We train the patients and their attendants to utilize this method instead of feeling fearful and helpless. We do healing of chemotherapeutic drugs and other drugs to neutralize or minimize the side effects and enhance its healing power. Also, healing by providing crystals, healing of medicines for severe autoimmune diseases, healing HIV patients, and healing of severe skin diseases have been done, where a double-blind study through chemotherapeutic drugs on 19 patients was seen where only 17 patients did not have any adverse effect. Healing of case of severe skin disease was done where a patient was not responding to routine treatment, and the patient was advised to apply the water which was immersed in the program crystal. Within 15 days, the skin became normal. Healing through mantras, prayers, meditations, and positive affirmations. These are some of the papers which are ongoing, with the paper on effect of self-healing through Om in deep relaxed state on the EEG was checked among nursing students and regular healers. The impact of Om was seen in both believers and non-believers of Om among EEGs, making them to relax very deeply. These are the papers which are in the process of analysis. We now have Dr. Sharath Kote discussing a case scenario of yogic healing and Dr. Bharti A talking about the effect of yogic healing on lactation.
Practicing this yogic healing for the past 20 years, started from my MBBS period, then the super specialty, and until now I am continuing this in my clinical practice as a complementary tool. It works very miraculously as a complementary tool, get a better results and a sustained results. To give such example, I had a 23-year-old male patient who had a chronic constipation, a subcategory of defecative dystonia which required a biofeedback therapy. He came to me for that. Initially, two sessions I given the biofeedback therapy, but did not get any fruitful results. Then I approached Unnati Healing Foundation and asked the healers to do healing for 6 weeks and also continued the biofeedback therapy for 6 weeks. Miraculously, at the end of 4 weeks, we got such a good result that he was able to pass the stool's urine without any difficulty, without any requirement of medications. And these results were sustained for almost nearly 6 months. Now also he is in my follow-up and he is feeling much better and enjoying his life. Thank you.
Namaste. As a gynecologist, we have so many sleepless nights. Yogic healing has helped me to maintain good health. As we are aware, emotions and thoughts will influence our hypothalamus pituitary ovarian axis, so its role in various gynecological diseases. Yogic healing has helped in patients going through a counselor. We have done research also. Stress, anxiety, depression is very common in the postpartum period. Yogic healing has helped lactating mothers to come out very easily. We were able to bring back happiness, joy in their motherhood, and increase the breastfeeding efficacy, and to enjoy the positive bondage between the child and mother. I strongly recommend that yogic healing should be a part of our care towards women's health and also to maintain one's own good health. Thank you.
Human tools are required to measure pranic energies, thoughts and emotions, consciousness, and so on. Here are a few of our references. Thank you.
Hope you got some insights. My PPT. Insights on how we can integrate, how important each system, how important it is to manage our holistic well-being. That is all 5 koshas. Very, very important. Let me proceed further. Can you just share the results of who took the healing here? The eye measurements? Vision. Yeah. Quick.
Namaste everyone. Just I want to show the impact of yoga. It's like this. This is the for a pain. Before the healing, our pain score was visual unlock scale. The pain score was 3. At the end of the pain, our pain score is 0. Next slide, please. Regarding for the refractive errors, before healing, in the right eye, she was able to read 80. After the healing, she was able to read 80. So that even the refractive error, the numbers have come down. This is after healing towards, sorry, this is wrong level, this is right hand, this is left side. Before healing, it was the head, she was able to read. After the healing, she was able to read till the feet. It is not miraculous.
Isn't it amazing? Do you realize our ancestors were much healthier? Yes? Now let us move ahead. Are these quite common in the modern day? Cranky children, stressed students, professional stress, family fights. If we can empower ourselves through a proper healing, proper lifestyle, proper approaches to manage our life, we can prevent this. Always prevention is better than cure, and health is our birthright. It is not told by me, it is told by Swami Paramahamsa Yogananda. Is it clear? I just show this. Any of these stress or tension you have, do you have any medication in any hospital? Is there any medication, instant medication for the fights, for confusion? We have to bring a change within ourselves. Okay? So, sorry. Let us, we are all born to manifest ourselves, manifest greatness. He is my teacher who I learned pranic healing, which has helped me to learn and go deeper into the yogic sciences. Master Chowa Kosugi, basically from Philippines. We need to collaborate, work intensity, and approach is more towards the health care. I have treated a lot of doctors. You know, we have so much of ego about our profession. If I need some support from other medical systems, there is so much of resistance to approach and seek. How can I go? That should be dropped. First level, we should go seek help. Second level, if the people or my students or my patients in need, we should be able to help them to get that support. When we drop this personal and professional ego, then the next step is possible. Our system may be wonderful, our understanding and application may not be better. So in that limitations, instead of just believing, I cannot take up the next step. If we drop that ego and take the next step, we can really help ourselves, help our fellow beings. Thank you. Very importantly, learn to breathe well, learn to make your aura brighter, happier, healthier through your emotions, through your wisdom, through your meditation, through your practice. Learn, experiment it on yourself, document it. That becomes the research. ಯಾರಿಗೂ ಪ್ರಶ್ನೆ ಇದೆಯಂತೆ? Yes. ಓಕೆ ಕ್ವಶನ್ ಅನ್ನ ಆಮೇಲೆ ತಗೊಳ್ಳೋಣ ಅಂತ ಸರ್ ಹೇಳಿದ್ದಾರೆ. ಹಾಗಾಗಿ ವಿ ವಿಲ್ ಟೇಕ್ ದ ಕ್ವಶನ್ ಲೇಟರ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you, Dr. Saraswati Madam. The job of Guru is not to interpret the scriptures, but it is to take you to another dimensions of life. Sadhguru. This statement is made visualized practically by Dr. Saraswati Madam. We know that how to treat Annamaya Kosha using Ahara and medicine, but how to treat Vijnanamaya and Manomaya Kosha, it is nicely demonstrated and it is delivered along with the results of this. Madam has told that to leave the ego, it may be professional or it may be personal, by thinking the whole day the activity which is done by us during going to the bed. So as it is same statement, also we can visualize in ourselves with the Nartam Dine Meyam the Katam Bhudasya Sankari, Dukkha Bhavna Bhavati Sani Itaskata. The statement is once again restated by our speaker, Dr. Saraswati. Thank you, ma'am. With great pleasure, I introduce Dr. K.M. Chidambaram. Sir has completed bachelor degree in pharmaceutical science from University of Mysore, diploma in research and development from MIT, India, master in pharmacy from pharmacy and pharmacochemistry from RGHS, Dr. Philosophy in biotechnology from CSIR University of Mysore. Sir is expert in biomedicine, molecular nutrition, molecular pharmacology, cell culture, and clinical nutrition, and so on. Sir has studied 4 patents, 111 research articles, which has 32 H index and 6,800 citations. Sir has delivered presentations at 55 national, international seminars and conducted 24 research training programs. Sir is the receiver of Dr. V.N. Patavardhan Prize from ICMR Government of India, Research Publication Award by Government of Karnataka, S.S. Mishra Memorial Award from AIMS, New Delhi. So now I request Sir to deliver a lecture on the topic Research Methodology in Alternative Medicine in Comparison with Modern Medicine. Over to you, sir.
Good afternoon, all. So it's my privilege and honor to present again. We met in pre-conference. Today I'll be presenting my talk in front of my one of the guru, Dr. Kumar, who is also my mentor. So I'm very fortunate. And more than 60% being a student community here, undergraduates and postgraduate. So what I thought was, so far we learned many things about the importance of alternative system of medicine and how alternative system medicine need to be taken into a mainstream. So as a student, 10 to 15 years back when I was sitting, when I listened all the good speaker talking about the theory and philosophy, I was always thinking that, okay, they are talking only theory part of it. How about practical, how to do it? And that's what something triggered me. I told ma'am, I'll try to give some information which is more directly relevant to the student. Like next 15 minutes, I'll just give a demonstration of what approach you need to take to convince alternative system of medicine into a mainstream. Basically, we are trying to speak Kannada in a Chinese term. So unless you understand and know what Chinese can understand, we cannot convince. So that's been an issue with convincing modern medicine in Chinese thing. And if you want to sell idli and sambar in China, you need to know how best to market it and what is the best way to make them understand the usefulness of the content what we are speaking. Unless we know that, we cannot market it. So that's why anything coming from NIH or WHO is taken very seriously and implemented throughout the globe, because it is tested and they work in a scale which can accepted by the global citizens. So what I thought was like Dr. Raghavendra has made my presentation a little easier, so I'll just jump few things. 5 to 10 years back, we were all telling there is not much market or value for the alternative system of medicine, because we were not able to convincingly give it to the consumer. So we found that the market using the complementary and alternative medicine, this is the only market in last 3-4 years projected to grow more than 10%. Usually average aggregate growth is 8 to 9% is considered as globally very good or a positive impact. Added to this, the pandemic has put lot of positive things towards complementary and alternative medicine, and which has resulted in increase of growth. The global cumulative aggregate rate of growth is more than 15%. So this gives an confidence that the science what we are doing is established and we have a very good market. And these are some of the values to scale you, like the Ayurveda product. This is one article way back in 2005 written by Ms. Padma, who was a scientific writer from Delhi. She has very well articulated 15 years back the components of Ayurveda and complementary alternate medicine are used for excellent business purpose with the global consumer going towards more authentic and more holistic thing. It was 15 years back and now it has come real, and you can see there is a 15% growth rate in Indian scenario. What I showed earlier was a global, and these are some of the ailments which even other speakers also told, like cancer, diabetes, which are major healthcare burden in our country, are now shifting from mainstream of allopathy into integrative medicine or use of alternative medicine. And again, the pandemic, as I told, it gave a lot of impetus and importance how integrative medicine and complementary alternative medicine can help the consumer. They are told like it is expected to reach 710 billions, because during the pandemic, it is not only the drug, antiviral drug or azithromycin, which is consumed in large quantity. It was most of the decoctions or kashayas what you otherwise prescribe for respiratory issues. And we saw more of these products consumed and accepted in a better way because of the personal experience. So that has given a big boon. And these are the 3 or 4 major plants or Ayurvedic formulation, otherwise known as immunomodulator and excellent adaptogenic property. They are now in the clinical study in different phases for corona treatment. So this is giving us a roadmap that there is a clear inclination towards alternative system of medicine and use of integrative medicine. But what we need to do, and these are some of the, there is an article, please go through it. All the students, please read this article. I'll share the details. And they have identified more than 60 genes which are specifically responded by all Ayurvedic and alternative system products, like all the rasayanas and panchakarma, and what are the procedure they are followed during the COVID for as an adjuvant or the supportive therapy. They are linked all of them into the modern medicine receptor and genetic thing. And now each one of these is pursued in different medical school or different institution as a project. Yeah, this is already told by my friend Dr. Raghavendra. So we have the Western world taking it more seriously than what anything which needs to be seriously percolated in our country, including Facebook and WhatsApp, we need to come from Western world. So we have imbibed it. Now Western has clearly given an indication these are good compared to thing. And the last 10 years of analysis in US said that more than 33% of Americans are willing to try, or they are making their mind to try only alternative system of medicine than consuming a toxic chemicals. So this is a positive move. And coming to the main thing, what is the missing link? Like when I analyzed my little experience working in India and Western US, and what are the major missing links? We all know that we don't speak a common language. If I tell a shloka in front of a Western person, unless I interpret, first of all, I should know the inner meaning of the shloka. What we are doing is we are just taking the literary meaning and try to translate it the way we want, either by a less experience or a person who is not competent to do that. So we need to talk a common language. We completely translate our Sanskrit or the Ayurveda literature the way it needs to be convinced into a commonly spoken language. So that is not happening, and this should be our first priority. It is not just give it to Google, it will translate the shloka into English. No, it has several inner meaning and hidden nothing that needs to be told and converted to a proper common language. That is something which is very big thing, and evidence that should be understood by everyone. Say now we saw a wonderful demonstration. As a modern medicine person or a scientist, I would think like whether that energy has something to do with the inflammatory marker, NF-kappa B, or some cytokines. What did that do in a microenvironment? Was there anything on the knee joint that has some effect? Unless we link that to a classical biochemistry, which we are taught from our childhood, we don't trust it. So we need to have that common language, and the way. And molecular and functional basis, whether we like it or not, now we have reached a stage when a newborn child will ask, you want to prove your parent? Show me DNA. So that is the stage we are going towards. And soon that will be practitioner. So we need to have evidence at the level of DNA to show each one of these work. Okay. And then good number of studies and subjects. This is something which we are trying to do. I congratulate Madam to bring all such tough leaders together to make this possible. Not one subject study or one institution study will never convince this, because when we were in US, one person wanted to present a paper on effect of okra or lady's finger on diabetes. He said, I have done only experiment with one person. It's the one subject study, still I want to present. And he was a clinician, and then he told, this is to start, that was in 2006, this is to start that the fruits and can also directly impact the disease. So they gave an opportunity. Recently, I learned that that has been converted into a phase 2 randomized trial with only using okra as a major component. So we need to do a larger study and explain the chemistry of the process and activity. So if you want to explain the pain, it is arachidonic acid, it is substance free, and the receptor is only understood and convinced. Otherwise, if you say it is status of mind, we don't have a quantifiable chemistry. Even if you want to say status of mind, I'll ask what is the endorphin level, what is adrenaline level. So we need to understand and tell them in a common language. And chemistry is the basis of life. Unless we prove that with the chemical information, it is not accepted by us and more in future generation. So we need to create that. And multi-centric and multi-location study. So if they say, because and this complementary and alternate medicine, more than pharmacology, it works in a trust. So we need to have trust with the therapy. So unless we get this trust from different people originated with different ethnicity, different background, we cannot achieve the total outcome and convince the globe that this can work universally. Otherwise, they say it can work only in some part of India where people trust it. So we need to do multi-location study and right method of approach. I'll just come to this. This is for the benefit of student. Like I interact with 3 major Ayurvedic college. One is JSS Ayurvedic College and Dharmasthala Manjunatha Ayurvedic College. And all the students say that, sir, if you can give us a methodology in a modern system, I can do that and convince it. Otherwise, we don't have a methodology in our classical test to prove this efficacy. They have given a shloka and how it works, and they have not given a methodology to convert it to a paper or data. So that is what I thought. I'll just give an example. So again, when you are choosing a method, there are n number of methods available in literature and internet. You choose universally accepted method and has a scientific basis, and it can be easily understood, and always go for a standard one, not go for something which cannot be translated to other part of the world and which can directly support the hypothesis. It may mean we need to understand the common terminology for each of these Ayurveda or alternate medicine with the modern medicine, and then try to link them and use the modern science based methodology to interpret, explain the ancient knowledge. So this is the best approach based on my experience. Unless you use the receptor and binding theory, you cannot take our alternative medicine to next level. I just come to one example where we have demonstrated. So what we are currently doing is we are trying to compare apple and orange. We say that, okay, this my kashaya works similar to ibuprofen or paracetamol. No, our kashaya is much superior compared to paracetamol or ibuprofen because they come with hepatotoxicity. Your kashaya will never lead to any hepatotoxicity and longer usage. So we need to tell them, and this is happening because we are trying to compare basic principle, diagnostic and treatment model. So these are the things we are keeping as the basis and trying to compel apple versus orange. But if you go to mechanism, how it can interact with the cells or unit cell, then you'll be comparing apple to apple, that different colors. So unless you understand the mechanism of DB to the domestic level, you will be comparing wrongly. So choose this method or mechanism of action to explain the concept, then I think we'll be justifying our work. And this is, I need not explain this to this audience because you are all expert in this. And this works with Tridosha, and we have Panchamahabhuta, which will explain the entire concept of life, disease status. And again, we have principles of Ayurveda which revolve around the variation in these three components in response to 5 elements of life. So this is basically simple terms what we learn. The modern medicine is not different from that. If you go to the molecular pharmacology, again the same thing. What the pharmacology says is any chemical which will interact with the molecule or DNA or smallest unit of the function, the cellular function, it will have a microenvironment around that. That microenvironment influence will reverse the activity or what it was doing with the influence of chemical. So the same thing what we as a human being get affected by Panchamahabhuta, the same thing is created in a microenvironment at the cellular and nuclear level. So if you go to the fundamentals, I don't think there is a huge difference. So let us choose this and try to convince the world. And this is something out of my own research. We had an NIH grant of 0.5 million to show Americans that consumption of citrus juice is beneficial in cancer. So they gave a lot of money, and it is, I take this as equal to any of our rasayana, which has multiple components. And for your surprise, when we did the chemistry, it had 418 phytochemicals. We analyzed all of them, we separated. That is not to prove that it is good. It is to show the modern world that these are the components responsible for the benefit. And other part is, initially, US came with the concept, instead of consuming a processed juice or processed food, consume a orange fruit than a orange juice which is readily available. They said, no, we don't have time and it takes a lot of our time. We want to go for ready use. Then what we did was, we all know that the orange, the whole orange is made to juice and it loses the peel, which is usually thrown out, the seeds and the white. This is the white powder which called the lamella, which is surrounded in the fruit inside the white skin. So all the three were removed. And when we did a phytochemical analysis, more than the juice, these three things which are not consumed had highest amount of all these compounds. So that's how we used to tell why people, when they eat a whole fruit, if not the seed, at least this white powder within the fruit will go. And now this white powder, which is called polymethoxyflavone, is sold at 1 gram for $500, which is a drug put it in a capsule for a lot of colon cancer. So this is what I want to say. And seed is used to extract the phytochemical, which is used as a nutritional supplement. And the phytochemical content of the seed is same as the neem or Azadirachta indica. All the triterpenoids and tetraterpenoids are same. That's why it is also bitter in taste. So we then to convince American or Western population, we did some experiment. I'll just run through it quickly. We used all different types of cell lines and explained everything in the molecular level. This is a colon cancer cell line where we took this compound, which is common in both neem and pink, and we have to show them what are the receptors, caspase inhibition and apoptosis induction, NF-kappa thing, and we have to meet the standard, we have to publish in the international journal where it is accepted. The concepts are accepted. This is one paper which we showed with colon cancer cell using this compound. And then the next is the same thing. We have shown this in the pancreatic cancer cell. Generally, pancreatic cancer is much deadlier than the other cancer. The mean survival time is less than 6 months. So we again showed that same compound can inhibit the inflammation and also inhibit the COX-2. And we have to elucidate the mechanism to convince the modern scientific community. And then we have to publish the same thing in toxicology journal to say that this compound, we never said that it is part of the juice or something. Each component we went and explained. And then we didn't stop there. The same phytochemicals, we worked with prostate cancer because it is a receptor hormone dependent, androgen hormone dependent. So again, there also we have to prove each of this component, like apoptosis, cytochrome C50. These are all established by chemotherapeutic drug. If you give Taxol or vincristine, they affect these molecules to prevent the tumor growth. The same model, same marker we selected, and we showed that these compounds can work on this equivalent to the standard drug. We used, most of the time we used to use the camptothecin, which is again from a Chinese happy tree. It is a naturally derived. To say that we are comparing apple to apple, we took that, and each experiment is compared with chemotherapy drug, and we said sometime it is doing better work compared to the drug. And this is the mechanism. Again, for each of this 200 odd compound we isolated in large quantity, we showed each of these can work at a molecular level to prevent different types of cancer. And again, this we recently published in toxicology. And one compound, this is the story of one molecule out of 400 odd. One molecule, the obequinone, which is the most bitter thing, we have to show in each of these cancer cells, breast cancer, pancreatic, colon, and prostate cancer, what are the genes that are upregulated, downregulated, and why it was not toxic to normal cell, why it was cancer cell. These are some of the questions we need to answer. So after 7 years, then we said, like, this is kind of a convincing sign. They said, okay, after 7 to 8 publication and 7 to 8 series of things, they said, okay, now we consider this, and what the government did is, like, to crush the seeds as well as the peel, and the biggest company which was producing both Sunkist and our Tropicana was asked, so not to crush, just grind them, both the peel and seed, and incorporate in the juice. So that is the impact of research, and it could convince. So, and when we talk about Ayurveda natural product, the next question was the bioavailability is very poor. So they always, the Western people or modern medicine people, we say that bioavailability, bioefficacy is very low. How do you address that? To address that, we did another thing. We all know that curcumin is a gold standard and universally accepted as a magic natural product. And we get curcumin in India. No, none of us go for a synthetic one. We get it from the root. Whereas most of the Western people, they use it as from the synthetic. There are two major companies in the world which produces. One is Fluka and another one Sigma, which produce curcumin from synthetic root. The starting material is acetone and other organic compounds. So when we compare, we wanted to show that why natural molecules are better than synthetic compound. We did an experiment. I'll just come to this later. So we have to show that natural curcumin versus synthetic curcumin. We all know that curcumin inhibit inflammation by NF-kappa B and cyclooxygenase 2 inhibition, and it has certain impact on AKT and other signaling pathway. And we did a commercial mix and a natural mix, and when we saw most of this cancer inhibiting thing, the natural mix N mix had a very clear activity of inhibiting the tumor cell, whereas the commercial mix or a synthetic one had not shown activity less than, greater than 10%. Further, see, this is clear evidence which says that, see, the NF-kappa B is supposed to be decreased, and the natural mix, this is the result from, this is the housekeeping, and it has reduced to this from this level, whereas in the commercial or synthetic, the reduction you can witness it. So that is the result. We said that for the first time, this unpublished data, we are planning to patent why natural molecules will have better activity, and then we have to convince them using a chemistry. Nature create all of them and store it in a particular stereochemistry. The moment it comes out of the, it is not produced for us to use. It is for the plant for its protection. Basically, we are using it. So it is produced in a particular this one optical isomer, which is active only if it is available. The moment you take it out and you can keep it for a short period, after that it loses its property. So this is what makes a big difference. And to increase the bioavailability, a lot of people in the Western world used to use the polymers, synthetic polymers as a nano material. They use a lot of this long chain polymer, which are basically a derivatives of plastic, to coat and put the drug. But imagine if you consume a small amount of plastic as a drug, what will be the fate? So we went one step ahead. The whey protein, the protein coming out of the whey plant, which is equal to this wheat-like material, we used that and coated this curcumin in that, and we could show that the bioavailability of curcumin was increased by 5-fold. And there was a paper from Professor Shobha and the team from St. John's in 2002. They told that beta-glucuronase is the one which cleave the curcumin and which is reduce the bioavailability. If you take curcumin, 1 teaspoonful of curcumin with a pinch of black pepper, which has an inhibitor, the bioavailability increased by 200-fold. So that's been practiced now. So what I mean is we have to take each of the smaller information and try to link it to the modern science. I think with this, if you do, this is another thing where we have shown first time in the history, this was patented and then published. A natural compound or a protein can be used for making a nanomaterial. Yeah, and earlier we had a market survey, because once we do research and convert all this product into market thing, we never had a separate post research analysis for complementary alternate medicine. In 2020, they have published from this research group how differently we can secondary evidence to convince the complementary medicine compared to main allopathy. They have a list of details which was not available 2 years back. So now they have exclusive post-research marketing strategy to take the complementary medicine to next level and to consumer level. So we need to follow this scientific method and then take it to the market. And what I would ask all the students is, please, whenever you are selecting a small project in Ayurveda or UG or PG, please talk to your mentor and try to find out the modern biochemical tools to demonstrate. Your simple radical scavenging activity with multiple chemical can be a starting point, and then try to talk to pharmacologists who can help you to take it to the next level, and do all the animal experiment in a way it needs to be done. And instead of measuring, because we cannot measure 3 doshas in animal, that is the biggest roadblock. So instead of that, link each of the dosha into a receptor or a clinical outcome and link it. That gives you a much better publishable and convincible evidence compared to what we are doing. With this, and this is some common complaints, sir. If you go to West, because most of my presented results were in the West, they say that they have blueberry, this broccoli. These are all nature's gift. They have olive oil. And they say that they have so many things. We are importing these things and paying them 500, 600 rupees per 100 gram and eating it. But my understanding is nature has given an equal opportunity to all. Like even in India, we have fruits which are equal to blueberry and our high value olive. So we need to work on this and bring, and most of these are unfortunately consumed by tribal people, and that is reflected in their quality of life and health. So we need to understand and bring it to the city life with good research support. And in summary, I would like to conclude saying that methodology used for research is very important, because entire your evidence is based on that. When you want to convince the modern consumer, what research methodology you choose is very pivotal and it helps. And then don't compare the treatment model. So they give some kashaya and all. See what ultimately you do in your body. Try to link to the mechanism. You will get a better thing. And try to work on mechanism of action, bioavailability, and PKPD to compare to modern thing. And whenever you are comparing, please take a similar drug, natural drug. Don't try to compare with paracetamol or diclofenac or some synthetic drug which is established. Then we are again doing wrong. Take something which is established within the natural product system. And advantage of natural ingredient over synthetic chemical should be focused. Even if you get honey in a synthetic way, more sweeter, and you have to tell that this honey has a better impact on diabetic, but not the synthetic one. So these are some of the things we need to do. And The last thing is like modern science tool explain the ancient system in a better way, and that can be more promising. Whenever you are designing your experiment for your undergraduate and postgraduate thing, please keep this in mind. And this is possible only through interdisciplinary collaboration. Please keep your mind open to collaborate, and then try to develop because all the responsibility lies on all of you are undergraduate student. After 5 years, you'll be going to postgraduate. Next 5 years, what all you do will be projected for future. Please use the approach, and more than happy if you need any help, we can interact and come back. Thank you.
Thank you, sir. Pariksha Karinoni Kushla Bhavanti. This statement is understood better after listening to Murthy sir lecture. Sir has given clear idea about how the integrative approach is added to the alternative system of medicine by observing the Indian market from 2015 to 2020. And also, sir has made us understand that integrative understanding of the science is better when we are communicating to the common people in their own language is important. And also, when we want to communicate the scientific material to the globally, it should be communicated with universally accepted, scientific, easily understandable method. And whenever we are carrying out of any of the research, the aim is not to compare blindly with alternative system or other system of medicine. Better to carry out the research by understanding the mechanism of action of drug, considering our own siddharthas. These are mostly similar that of the modern pharmacology also. And also, sir has given importance of carrying out of the research with the post-research marketing survey and selection of the proper methodology of research. So thank you once again, sir. Now it's my pleasure to introduce Dr. S. Kumar, former Chancellor, Sri Devaraj University, Kolar. Sir has served as the President, Medical Education, Vocal Education Foundation, Health Sciences. He was promoter of MS Ramaya Group for 3 years after serving as Principal and Dean at MS Ramaya Medical College and Hospital for 7 years. At MSR, sir has coordinated more than 20 field trials in rural health sector over the past 3 decades, sponsored by WHO, Netherlands. Sir has trusted for Spandana, a resource center for differently able children in rural areas serving 36 villages. At present, sir is serving as Executive Secretary and Trust Director of Community. Sir has visited Vienna, Hungary and Japan as a part of UNIDO delegation to evaluate environmentally safe management of healthcare baseline. Sir has received many awards like Award for Excellence in Service Community in 2005 and 2006 from Rotary Bangalore, Northwest and Lions Club North. So now I request her to deliver the lecture on the topic Integrative Health Science Education for Better Understanding the Way Forward. Over to you, sir.
Thank you very much, man. It's a wonderful audience sitting with a lot of patience, and you have seen the scale to which, through the morning session, we have stimulated that interest in you to think beyond the routine. Sun rises in the east, goes down the west each day, but there must be some days where you think differently. You know, sometimes it was non-proper to have, I'll make a few confessions here after having been a medical teacher for 42 years. Sometimes I think of what have we missed. I pass those points. It is for you to grab the opportunity in that and look beyond. So, like You have to find the land before sowing the seed. All the speakers have done a wonderful job. When Dr. Saraswati said 20 years and we need to do something different, I said, why don't we stimulate youngsters? Our generation has failed to bring different disciplines of healthcare together or see eye to eye. We have failed. The bad ego has prevented people from seeing the best practices in traditional Indian systems. We learn about our best when it comes from the West. ಅಲ್ಲಿಂದ ಯಾರ ಹೇಳಿದ್ರೆ ಅದು ಸಂಕಲ್ಪ ಬಂದಿದ್ದರೆ ಅಷ್ಟು ಒಳಗೆ ತಮ್ಮ ನಮ್ಮಲ್ಲಿ we don't wake up. So this is only to start this, and please bear with me only a few moments. And before I say anything, undergraduate sitting there, you don't have to wait 5 years to be a PhD and then a faculty and then start thinking of research. The first initiation to research, like, does anyone have to tell you who you have, brush your teeth before you start your day? Makkalagiddaga heli, now it is internalized. It is part of your system. Just a little while ago, you heard Dr. Chidambaramurthy. That thrilling scene in which he was jumping from the depth to come back to the surface to keep you engaged. Don't learn your subjects as an undergraduate with marks of the exam in mind. What information your teachers, your Google, your library gives, take time, absorb it. Once you absorb information, it becomes knowledge, and that knowledge will stay with you till you pass out. All right, let's go. Sometimes it refuses. No, a very small, till the system at least starts responding. A very small observation. When you are tired, you go home at the end of the day. Whether it is modern medicine or Ayurveda, it says that the ultimate source of energy is ATP. What is ATP? Whether you eat a bell pudding or badam halwa, it becomes ATP. That's what we teach. But when you're very tired, the energy levels are gone down. It is not like you have to put petrol to recharge. You tell your parents, I'll go have a shower and come. You go have a shower, you feel very fresh. All that pain, all that energy level comes up. Did you take ATP when you had a bath? At the most, you would have gulped 1 or 2 mouthfuls of water. Will you get the same relief of energy levels if you drink a glass of water? No. And the same bath, you have a hot water bath as against a cold water bath, which is a refreshing cold water bath. Why? Why is this happening? These are questions that you should start asking from day to day happenings in your life. Okay. Now I just want to tell you this. Highest number of medical colleges in the whole world, 539, which forms nearly 21% of medical schools spread across 260 countries. Whatever reason, last 3 years, they increased the number of undergraduate seats by about 45%. Now we have close to 80,000 allopathic undergraduates each year. They also increased the postgraduate seats during the last 3 years by 72%. India contributes the maximum to the pool of specialists and super specialists. Now, I said I'm talking to a young group of friends from the Irish. Are you aware, in comparison, we have a total of 733 Irish-based colleges in this country, of which naturally Ayurveda is standing up, 400, homeopathy, the numbers are there in front of you. And the distribution of these is so skewed that Maharashtra has the maximum number of them, 146, and thanks, Karnataka is just behind at 101. So you have this background of this number of institutions. I tried my best to get the number of students enrolled in these 733 institutions. And like I told you, gave you a figure of nearly 80,000 in 539 medical college. Numbers were not available in any organized way, and so therefore not presenting. But still, students who have put their trust, faith in these two streams are almost of equal number. All right, next. With nearly a lakh and a half graduates in medicine. When I say graduates in medicine across all streams, what are the nation's dubious distinctions? Even today, our immunization failure is 20%. Not COVID. COVID is little more vaccine hesitancy. I'm talking about childhood immunization. Maternal infant mortality is still at 14 to 16%. 14 to, I'm sorry, the symbol percent is wrong. 14 to 16 per 1,000 deliveries. Whereas there are countries where they can confidently say not one mother has died because of childbirth in the last 5 years. I'm not talking of the West. I'm talking of Southeast Asian countries around us. All of them have a better record than Hamara Bharat Mahan. Death due to malaria and at dengue is still more than a lakh per annum across the country. Tuberculosis cases, every 9 out of 10 people are exposed to tuberculosis, but only a fraction show it as disease. 70% of leprosy patients are in our country. They are purely treatable bacterial infection. What a shame, because we have attached a taboo to it. And 10 lakh children die before their first birthday. What are all of us as doctors do? Next, please. Now we only focus teaching anatomy, physiology, etc., etc. And when it comes to nutrition, 3% of a medical curriculum spread over 4.5 years focuses on nutrition. Have you ever recalled any recent times a doctor what to eat and what not to eat? In allopathy, no. Eat better at least in Ayurveda, you have linked your therapy to food. At least you give them more don'ts than do's. That's why people are a little cracky about accepting yours. Too many don't. You don't eat this, don't do this, or all this. The whole world for the last 2 decades is working on therapeutic benefits of fruits and vegetables. We still teach vitamin C, good for gums, vitamin A, for the eye. What are we? We're medieval in teaching our students. Murthy was talking. You want us to see his profile, Google him as pomegranate Murthy. More than 9. He has at least about 30 publications on pomegranate. Antiviral, anti-inflammatory, antibiotic role. Please see that. Why did our system suffer? See, we have totally missed out the micronutrient. I was able to rattle out. There are phytochemicals, carcinoids, anthocyanins, proanthocyanins, tannins. You should identify with confidence. Ayurveda will be accepted the world over. You say tulsi is good for the heart. What component of tulsi? That is what the question they want. Turmeric is the one of the best antibiotics. What component of turmeric? No attempt has been made. It has come down from generations. So Ayurveda has suffered from lack of validity. Now, we want to, that's why I say awaken. It's not only cancer, it has a role in treating non-communicable diseases, hypertension, diabetes, stroke, cardiovascular episodes, peripheral angiopathies. You know it, name it, there is a spectrum. Next. 1/3 of cancers are preventable with diet and lifestyle. This is an open challenge. If two amongst this audience, with their dedication, can work in this line, how many of you are aware that 1/3 of malnutrition cases in the whole world is in this country? 1/3. It is not in Somalia, not in Africa, not even anywhere. That is because we have no concept of our diet. National Institute of Nutrition, established by the government of India, excellent work they do, they publish it. They are very happy. We have published our report. They don't bother to communicate it to the community. What is the benefit of their work? They are not reach out. If you are confident, if you have that Atma Vishwas, you have done quality scientific work, why are you shying away? Now go to any Western country, the first initial 3 rows in a Walmart or a Costco or any other massive department stores is off-the-shelf Ayurvedic products. I've not seen so many in my own country. Have you seen any Indian super bazaar keeping off-the-shelf Ayurvedic? Why? Because we have not communicated to raise the level of confidence. All right? Just one second, please. No, there is a simple thing. If you can't really do, till you get into the position of being authoritative like Murthy, 50-50, make it 5. Please buy half this. If you want to prevent malnutrition in this country anymore, 50-50, make it 5. That means of the food in your plate, 50% must be cooked and the other 50 uncooked. What is a grade 5? There should be 5 colors in your plate. 5 colors. If you ensure that is there, no Indian meal has any deficiency or anything that will cause malnutrition. All right? Thank you. Next, please. Now, dietary guidelines, there are called fortifications, they are called enrichment food, enhancement foods. Now, there is a lot of confusion about what is a balanced diet, what is undernutrition, malnutrition, and even overnutrition is a disease. So, minimal efforts to communicate. Please, as doctors, take a little time to communicate the goodness of food, not as a preventive, but even as a therapy. Next. As I said, this 3% of the chemical, and you don't adopt this call divert philosophy. Any patient really genuinely asks you, what should I eat? Go to the nutritionist, she will tell you. Don't adopt that call divers. Next, please. Static overload. I said we are sitting on a bomb. We don't know when this malnutrition will explode. Do you know that still after years of talking, when ferrous sulfate tablets are available for less than 5 paisa in the whole country, 74% of women in rural India are anemic. What a shame. Next. This is what we are doing. Irrespective of the number of resources we have, if you don't know to use it, You will be like this unfortunate man standing desperately on a heap of ladder just to look at the other side. We want a better race in our country. We are not utilizing the so many things available. Next one, please. Now, this is a concept, I think, how this is more towards stimulating you to think of diet and nutrition. One thing you must remember, India has champions, individual champions. But by stimulating you young people, we want to have a champion team. There's a lot of difference between individual champions and a champion team. And I'm coming back to research in that. Please, whether it is Ayurveda or allopathic system, bring a change in the curriculum. Emphasize interdisciplinary exposure, training, and collaborative, meaningful, translational research. Each word has a meaning. Collaborative, interdisciplinary, what should translate into some benefit in healthcare. I was so happy to hear that AIIMS Rishikesh have started thinking in this line, but Bangalore has not been behind the same institution where I was associated. 24 years, we were the first medical college with allopathic system to have a full-fledged Ayurvedic department and mandating every student to have a 15-day posting there to see for themselves, observe and learn about the best. Next. Okay, we need to restructure. Abdul Kalam said, any nation which wants to progress should learn to make the young generation that make wealth and weapon. Next. Please, next. Yeah. Talking of little money that I researched, there are so many people who are slogged and done more days. Let me put a challenge as far as money. I told you the number of products that you can go. There are more chances to emigrate to the West as a well-qualified Irish system doctor. I repeat, if you are well qualified in the Irish system, more chances to emigrate than any allopathic doctor. And I'll tell you about the opportunities of health. I'll quickly go through the slide and tell you. Quick. Now, we have world-class hospital comparable with anything, whether it is UK, USA, North America, Canada, anywhere. There's no waiting period for chronic procedure, whether it is stenting or bypass or respiratory surgery, open up, thoracic surgery, or any neuromuscular procedure, knee replacement, hip replacement. Any of them is possible in India, and our success rate is definitely higher. I put the figures there. And we get immediate best of nursing care, compassion. There it is profession. Here there is a passion still in some nurses. All right? And low cost. At 1/10 or 1/4, we get that. And we are major advantage. We are the best English speaking speaking country in the whole world. All right? The Federation of Indian Industries had reported that 1.3 million medical tourists visit Asia. We have been able to attract only a small fraction of that. Majority of them go to lesser competent nations like Philippines and Thailand in particular. All right? Look at the money. In 2017, we have touched 3 billion in the market. Sir, why is all that? Are you mad? Why are you telling us about all the billion? We are, without you in the team, this health tourism cannot occur. Please mark my word. If it is a cardiac procedure for which a patient comes, or a respiratory, the agency says, do you have yoga, pranayama, and similar during the rehab period? If a hospital says no, they are out of the race. Similarly, any neuromuscular skeletal surgery, Do you have your eye ready to go putting on those massages? Among away. Do you have that recovery? They know. They have experience. There are publications. They showed you the huge gap of not even 20% research goes on about your system in India. They have studied. If all this is available, only then you listen. So please don't study for exam. Gather as much information, internalize, and then you have the whole world, and you will certainly have a part of this $3 billion in the days to come. All right? Change. Please note, America may talk big. They can walk out of any place, whether it's Afghanistan and any. More than 50 million Americans don't have a health insurance, and the number is increasing. So there is big money for you if you are competent, if you have accumulated knowledge, not information. Next. Forget money. No, this was only, I had time to motivate. This is time for their lunch. So let's join hands, my friends. Let's join hands. Let's make a better tomorrow. Please forget these unfortunate people who have brought in terminologies like mixopathy. Elapathy, I think the last is mixopathy. No. You be clear in your thought how you can add value through the system that you are qualified in. Don't try to trespass. Don't try to trespass. You prove your system is more efficient, and that will be good. That will make our country, like our Prime Minister says, Atmanirbhar, with pride we can say we have integrated. I've been to several medical institutions in China. From day one, they have integrated their local traditions with the modern medicine. You turn to the right, you go to allopathy, patient goes to the left, it is there. And only junior level doctors in the ground floor. No remedy, you want to crisscross, no questions asked. That should have been the integration that we had. We have only carried out with the education system which the British have left for us. Please think different. And institutions, there is a huge research grant waiting to be tapped. All right, all the best. Have wonderful years. God bless.
We have a concept of Jnana Vruddha in Ayurveda. So, listening the words of Kumar sir, how experience makes man perfectly understood. Sir has given us Sapta Vachana, leave ego and make information, internalize and then convert into knowledge. India is a hub for education. India contributes specialists and super specialists to the world. Thank you for giving us rule of 50 into 55 and also for encouraging what we need to do in this field is to encourage scholars to utilize the resource properly. And we need to adopt collaborative, interdisciplinary, translatory research in Ayush. So thank you, sir, once again. Now I request Dr. Rahane Sharma, Principal, GMC, and Chairman for Innovations, PG, excellent moderators, and we have all of us to speak few words. Very good afternoon to everybody. Namaste to all the seniors here, to all the faculty of SKMC and my very dear students. We have come to the end of a very eventful program today. As I heard Dr. Kumar and as our anchor very beautifully put it as Jnana Vruddha, the thought that came to my mind was, India is the storehouse and kitchen of everything, but the supply chain is completely outside. The publications come from here and the real work goes on. And all these concepts of integration, as my colleagues and I were talking, we've been doing it through and through in our practice, but we haven't showcased it. We haven't put it across, as Dr. Chidambaramurthy said, in the common language that people can understand.
Atmavishwas.
Yes, Atmavishwas, Atmanirbhar will be the two new words our students will walk out with, related with their knowledge, their conviction about the science that they have studied. We had a very eventful day with Dr. Raghavendra, who started off the session talking about the current status of the affairs, who wrote out the statistics and the number of papers India has actually produced in the Ayush sector, and that is a big way forward where you have scope for research and publication. In fact, research as a full-time career, as we discussed on Thursday. And again, as Dr. Kumar sir said, the amount that is there with the government, with agencies, is quite a bit. Right from Karnataka Education Authority, to whom your seats are allotted, everybody is funding research. My dear students, you are aware of the Rajiv Gandhi University's undergraduate research program, where a small grant is given to all the students, not all, to the selected students who put in their proposal. I suppose we should recommend and request the university to extend it to the postgraduate level as well, for more of a biotechnology and instrumentation research and the concept of molecular and the chemistry based that he was saying. In fact, I remember a thesis that I had a chance to be a part of from the Amrita School of Ayurveda, where the Vamanopaka dravyas were understood at the molecular level and how Madhurapala can act and what is the mode of action of that, which makes it crystal clear. Two drugs put forth like that, and then we are done. But again, I would quote Dr. Murthy, who beautifully said, the plants have that chemistry for their own use, and look at man exploiting every bit of earth for my good. I don't know when we would also want them to live and say, please continue and take something from me. Maybe better carbon dioxide so that they can give us better oxygen. That's all we can give. We had Vartika Saxena madam, who beautifully showcased the research that is going on. Dr. Saraswati with the most benevolent idea of inculcating this idea of research. And again, as sir said, the way we are trained to comb our hair and brush our teeth, research must become a part of our students where you are able to think and say, why this, why not so, or how is it so? I was just reminded when we were talking of all the integrative sciences of a simple example that I used to give my students when I started teaching them in the first year. What is the date today? Today happens to be 26th. Am I right? 26th? 26th of? 26th of September 2021 from the Gregorian calendar. So we are 2021 years, 9 months and 26 days from the start of the Gregorian calendar. We are in Plavanama Samvatsara, Bhadrapada Masa, Krishna Paksha, Shashti today. Are the two the same? Do they concur? 60 years later, I will get Plavanama Samvatsara once again. The same Bhadrapada Masa, the same Krishna Paksha. In 2081, 26th of September will be a Friday. We don't necessarily come together, but we are living in the same day. I come from my approach, they come from their approach. They, I mean, any other system. For the other system, I come from a different approach. But we have a common point. And our basic interest lies in the common point. And how do we bring the common point so that the difference, the seeming difference can actually come down? And this is where I remember Vagbhata, again, as Dr. Murthy said, that it is not that we wrote out shlokas, sir, but it is that I want to tell you, whatever you mentioned, Bhagavata brings it out in this shloka. Ajnana Shastra Sadbhava Shastra Matra Parayana. A person who is ignorant of the Sadbhavana, of the actual intent of the Shastra, but studies the Shastra superficially. He is like Shastra Matra Parayana, Tyajet Durat Vishak Pasha. Such a Vaidya must be kept aside. Tyajet Durat Vishak Pasha. Pasham Vaivasvataniva. That doctor is like the noose of Yama. So you keep him away unless you know the real Shastra. This is the extent to which integration was already done in our system. Now, sir, coming to your point of common language, very agreed, without losing out on the ground of Ayurveda through which we come. All the research that happens with the pharmacological single plant molecule, single, as you were mentioning, 6,480. Look at it come from the complete one. This is where I always feel Rajiv Gandhi University or any university, in fact, we are one of the more progressive ones, must give the Irish students a trial life before and after with your full line of treatment. We take away everything, give them the point of the knife, not the handle, and say, now you execute your. So this is one major change we need to bring. And I'm sure conferences like this, and I hope you recommend it to the universities across, write it out to the people. There we can have a policy. And until the thing comes in policy, even the National Institute of Nutrition, the research paper is there, but is it being implemented? So implementation becomes the most important one, and I hope conferences like this will do it. And then, sir, I quoted you enough, you came out very beautifully. The 20 years of your experience, it was in fact a class for all of us. We really enjoyed. And Kumar sir, it was a blessing to hear you. I remember Dr. B.M. Hegde's book, which says, what is not taught in medical colleges? In fact, some of the most important ones. I'm sure our own students who would be probably seeing a patient for maybe arthritis, which we commonly see, and the patient is on warfarin, and they have to give Shunti because we want to increase the bioavailability. Warfarin and Shunti don't go well with each other. How would they do? We wouldn't have taught them. We would teach them one part of Shunti. We would teach them one part of arthritis. This drug interaction, this new concepts, this is the challenge of the students of 21st century, which we need to introduce, as you very rightly said, sir. Very beautifully conducted program. Dr. Saraswati ma'am, I'm sure your interest, in fact, you very beautifully evidence-based, you showed the cases of two students, which I'm sure they would be, students would be very enthused with. In fact, it was a learning for all of us. So with these words, I would not want to hold anybody else any longer. I'm sure our students have got quite a bit of their own ideas. I mean, you just have to stimulate them. They are one whole bunch of energy packets. You just have to stimulate them in the right way. Yojakastatra durlabha. Ayogyaha purusham nasti, yojakastatra durlabha is what we say. There is nobody who cannot do it. We just need the right path. And the right attitude, and the path probably will manifest with God's grace and Dhanvantari's blessings to everyone. With these words, I thank you, ma'am, for giving me this opportunity. And I thank you. Thank you, madam, for motivating all our delegates and stating about the opportunity what it is there ahead us. Thank you for summarizing all the speakers, the deliberations. Once again, madam, whatever she has told, summarizing from me is not possible because she has nicely summarized. Once again, summarizing is not possible. Thank you, madam. So now I request Mr. Y. Srinivasa, Unnati Associate, former board member and executive director of Everest Industries, to deliver vote of thanks.
Namaste. With the permission of the chair, I wanted to say a few notes to you. Ultimately, whatever theoretical we have done, unless it results into practice and implementation, as everybody rightly said, we don't get the entire essence of this 4 hours of deliberations, very high quality deliberations. May I request all the students in-house and online to go to Unnati website to register themselves for upcoming opportunities where a collaborative work can be done. There is nothing wrong to look at various possibilities. Who knows, you may hit a gold mine and see that there is a possibility in your approach for a holistic approach towards medicine. I am not the doctor, I am into management. where in management we go with an open mind for enrichment of the business. So when you are open mind, probably you get into lot of ideas. You are all young, energetic. I should really congratulate the college. During the session, break session, I interacted with lot of students. Contrary to my belief, there is lot of positivity, futuristic approach, and lot of hope in enough every one of the students I interacted. Probably that is the reason Unnati Healing Foundation, in collaboration with eminent people, come up with this program. And let us take this movement forward. We may come up with some announcement future, which may be useful to you and the society. Once again, please set aside 10 minutes of your time. Go to the Unnati website. Understand what Unnati stands for. You will be getting a brochure, every one of you. So we will be happy if you spend few minutes of your time understanding what Unnati stands for, how a collaborative work can be initiated going forward. The first step will be to register yourself on the website. And I will not come between you at the lunch, as we are already late. It is customary to and also necessary to thank all the people who made this wonderful and intellectual and practical conference a successful. First of all, I thank His Holiness Parama Puja Jagadguru Shri Dr. Nirmalanandanatha Mahaswamiji, President Adi Chunchanagiri Shiksha Trust, for this happening this occasion in this college. And we are thankful and indebted to Dr. Raghavendra Rao, Director, Central Council for Research in Yoga and Naturopathy, for wonderful keynote address and giving a lot of insights. And we are very, very grateful and thankful to Dr. S. Kumar, former Chancellor, Sri Devraj Urs Academy of Higher Research. So, on behalf of Unnati and Associates, may I request Dr. S. Kumar to come on the stage. Please. So, he is the man we have. We are also we gain a lot of knowledge and wisdom from Dr. Vartika Saxena, Dean Research, All India Institute of Medical Sciences, for enlightening talk. And we are also grateful to Dr. Gao, who was the principal of this college, for his involvement and encouragement for this participation. We are also grateful and thankful to Dr. K. Chidambaram for the wonderful practical way of presenting the research for everybody. Thank you, Dr. Modi. And we are also thankful to Dr. Indranil Basu for sparing his time and sending the recording of his presentation, which will be available on our website. And last but not the least, we are grateful to Dr. Saraswati Hegde for taking this movement forward for the well-being of the society in the plant. Thank you, Dr. Kumar, for blessing this occasion and Unnati. And we are also grateful to Dr. Naina, Dr. Supreet, and we are also grateful and highly motivated to listen to Dr. Ahalya Sharma, I think Dr. Anurag been with 99.9 majority to put a vote in this group. 0.1% so otherwise we would. So I have only seen political people getting this kind of huge process. And supporting unity for making this function happen. Thank you very much. And we are thankful to Dr. Naina, Dr. Supri for behind the scene work. May I request Dr. Gao to come on to the stage of dais. Dr. Gao. So in fact, during the conversation with Dr. Gao, he showed a lot of interest for research, and he said he would work personally from the institution will encourage for the research and wanted to address you. Dr. Gao, please come on. I'm very happy. I'm not from the research background. I witnessed Dr. Gao have. He wanted to say a sentence.
I think all of you are waiting for lunch. I would like to just recall my teacher, Dr. Langesh Parmesh, who taught us discipline. He used to always say, you have to remember four things: data, information, knowledge, wisdom. The data that you are going to collect is to be transformed into information. The information that you are going to get is to be transformed into knowledge, and the knowledge is finally to be made use of into wisdom. So with these words, I would like to thank Dr. Anurag for giving us this opportunity, and Dr. Saraswati for enlightening all the students through these various talks. Thank you, ma'am. Thank you very much.
We thank all the people from the associates and for making this happen. We thank all the participants, all the people who made the arrangement possible, the photography, the behind scenes people, and all the housekeeping and people. And last but not least, Dr. Priyanka, thank you very much for wonderful organizing the program. We also grateful and thankful to the media who gave it to this function and wants to cover this program for the overall benefit of the society. Thank you. Thank you, everyone. We also ask for blessings of the masters and the great souls to bless this occasion and make this program successfully. Thank you very much.
On behalf of the institution, I will take opportunity to express my heartfelt thanks to Jagadguru Parama Puja Shri Shri Dr. Nirmala Mahaswamiji, Puja Shri Saminatha Swamiji for extending all the facilities. I express thanks to Kiran and Block Principal Sir for guidance and constant support. I express thanks to Unnati Unnati Association for Unnati Foundation and Bangalore Zone Principals Forum for providing opportunity to organize conference at our college. I express thanks to all the faculty who came here from JMC Bangalore and SCMIH Bangalore. And also I express thanks to Dr. Nayak, Dr. Shreyas, Dr. Supri, and Dr. Sindhura, and all the technical teams who are present on here. And also I express thanks to all in-house and online delegates who made us this program grand success. All the registered delegates will be receiving e-certificates through email. I request everyone to join for lunch